Okay. Croeso, Bwrdd, good morning and welcome everybody. This is the second public board meeting of Digital Health and Care Wales, following the inaugural meeting that we had on the 1st of April, which was very much about us getting established as a new special health authority. But I'd like to extend a warm welcome to all board members and those members of the public who are tuned into our live feed today. Just as we start, I would remind people who are with us that Digital Health and Care Wales has picked up from where the NHS Wales Informatics Service NWIS left off. And is a new organisation that's here to support the health and care system to enable the delivery of high quality health and care in Wales. It's important to recognise, I think, that DHCW literally touches every part of the NHS in Wales, and every patient interaction, many staff interactions that take place somewhere, DHCW is supporting those processes. So it's a critical part of the NHS family. And as I think we're all aware, the digital agenda has never been more important in delivering healthcare than it is at this moment in time. If I can just say as well that in terms of COVID-19 restrictions, obviously we are still unable to gather in formal sort of public gatherings, and hence the reason that we're broadcasting today's meeting live, though we will continue to do that even when we are able to get back meeting in person. But it does give an opportunity for anybody with internet access to observe in real time what the board is discussing. And we've made sure that those contact details are available through a variety of mechanisms prior to the meeting. For others who can't watch this in real time, also to remind folks that the recording of this meeting is available on our website on the YouTube channel. So I would like just to as well extend my sort of formal welcome to all those members of the public who are joining us today, and indeed any other stakeholder colleagues who I know we've got some with us today as well. Just in terms of the protocol and sort of timings around today's proceedings, just to remind people from outside who are watching in that colleagues who are speaking, myself included, won't always be looking at our cameras because we do have papers in front of us that we need to refer to during the course of the meeting. And that often there will be a little delay as we bring other people into the meeting as the live feed switches. So if you get some what feel like slightly odd pauses, it's just us working our way through bringing people into the live feed when it's their turn to either present a paper or to ask a question. In terms of the timing of the meeting today, we are scheduled to finish between around about 1:30. I'm hoping we'll get through the agenda by, and we are scheduling a comfort break around 11:30 after the end of part 4 of the agenda for 15 minutes. There may have to be a little bit of flexibility with that, depending upon how tight to time I can keep us in terms of the agenda items. For board members, obviously the first part of our agenda, when I come on to that, is around the consent items that we have shared prior to the meeting, and there's been an opportunity for colleagues to comment on those because these are issues that we've discussed before. There is an opportunity if anybody wants me to bring any one of those items back onto the agenda today, but if I don't see a question or an issue being raised by somebody when I move on to the consent agenda items, I will just remind us specifically what we are agreeing to today. Okay. As we go through the meeting, I'm not intending to do a round of introductions again for members of the public. We did do that at our first board meeting, but what you will notice today, hopefully, is that individuals have got different backgrounds. Names are on those backgrounds, so you'll be able to pick that up as we go. And of course, profiles and biogs are available for board members on our website for those members of the public who want to know a little bit more about who we are. Okay, I think that's all I wanted to say by way of sort of housekeeping notices and introductory comments. If I can move us on then to item 1.2 on the agenda, which is around apologies for absence. I haven't received any apologies today, and as far as I can see in terms of names on screen, we're a full house in terms of the board meeting today. Item 1.3, terms of declarations of interest. I haven't received any from any board members in relation to any items that are on the agenda today. If anybody does want to raise anything, please please feel free to pick that up, but I will assume that there are none. What I would add, however, is that we have or we are just completing the first cut of our register of board members' interests, and so fairly shortly that will be available on our website for others to look at if you wish to. If I can move then on to section 2 of the agenda, which is the consent agenda. I'm not picking up any comments from board members, so I'm going to assume, unless I'm stopped, that everybody is comfortable with the items that we've got on the consent agenda. But for the record, it's important that I just take us through to note that we are approving the minutes of our first meeting, item 2.1. We're noting the action log. There is one action on there which relates to committee membership, and that will be picked up shortly in my brief chair's report. We're also noting the amendments to the first draft of the standing orders that we took at our first meeting, because they've been updated to reflect the terms of reference for the Digital Governance and Safety Committee, and there are some slight amendments to the standing financial instructions. So we are approving these standing orders and standing financial instructions under this part of the agenda. And then finally, we are also approving the DHCW board cycle of business, which is set out in item 2.4, whilst recognising that the work plan will of course be fluid during the course of the year. So it's our best effort at this stage in terms of trying to plan board business through the year, but we will of course have to be flexible as we pick up things that occur during the course of the year. So I think that is everything in relation to the consent items on the agenda, and if there are no issues that any other board members wish to pick up with me on that, I will move on now to my chair's report. First thing on the chair's report is a very pleasing thing for me to be able to do, which is to delighted to announce and welcome Helen Thomas as our substantively appointed Chief Executive. Helen, as you know, was our interim Chief Executive, and that was the status at our first board meeting. Since then, we have been through an extensive recruitment process. An external recruitment organisation was commissioned to support the board in this exercise. We had a very strong shortlist in moving into final interviews, but the outcome of that was that Helen was appointed as our substantive Chief Executive, which I'm delighted about, and delighted to be able to welcome Helen here today in that capacity in terms of our first board meeting with her as our substantive CEO. So welcome, Helen, and well done. In terms of committee membership, this was the item to pick up from the last meeting. We have now fully populated our committee structures. So in terms of the 3 committees that we have set up, the first is the Audit and Assurance Committee. Ruth Glazard, our Vice Chair, Ruth Glazard is a member of that, our Vice Chair. Marion Jones is one of our independent members, is the chair of that group. We've got, in terms of Digital Governance and Safety Committee, Sian Doyle is the chair and Rowan Gardner is the vice chair of that group. And then in terms of our remuneration and terms of service committee, I chair that, and all members are members of that particular committee, with Ruth as our vice chair, also acting as the vice chair of that committee. So we have completed that action. All our committees are up and running, each of those committees has had its first meeting since the last board meeting, and we'll come on to highlight reports from those committees later on the agenda. We are also in the process of appointing our associate board member from trade unions who represent staff within the organisation. That's in line with our membership regulations, and we're working with trade union colleagues to appoint an associate member to the board as soon as possible. To be eligible for that role, the person has to be a member of our staff and has to be a member of a trade union recognised by DHCW. The trade union associate member of the board will attend all of our board meetings in an ex officio capacity, and will engage in the other sort of key board activities such as board development sessions as well. So we're looking forward to concluding that process and appointing to that associate board member role in the near future. Hopefully I'll be able to update you all at our next meeting in terms of progress on that. I also just wanted to touch on the conduct of our board meetings and committee meetings during this period when we are still under the restrictions due to COVID-19. I touched on this already in terms of my opening remarks. We outlined at our first board meeting that we wanted to look at alternative options to maximise accessibility to our live streamed board meetings via a suitable platform to make it easier for citizens and stakeholders to access our meetings live. We also need to move as soon as we can to a position where we are able to offer simultaneous translation during those board meetings in Welsh and in English. Where that's taken us is that from our next board meeting, we will move to a different platform for the board meetings. We're going to be using Zoom rather than Teams, because that makes it easier for people to engage, and it's easier for us to run the sort of simultaneous translation process through that as well. As I've said already, of course, our recording of our live stream meetings will be posted on our website after meetings and is available there for people to see. We will continue to make sure that board and committee papers are available to the public on our website. And we are working to ensure access to future committee meetings for members of the public as soon as that is practically possible, and COVID restrictions allow. It's an important principle, I think, and it certainly is for me as chair, that we apply the same sort of standards of openness to our committee meetings as we do to our formal board meetings. There will, of course, always be times when there are confidential items that need to be discussed by the board in private, in terms of things with potentially sort of commercial sensitivity or staff sensitivity, but we will ensure that they are kept to the absolute minimum, and ensure that we conduct our business in an open and transparent way as an organisation. So without any further comment from me, that's the issues that I wanted to highlight in my chair's report to this meeting. So I'm just formally asking the board to note that report, but if there are any questions, I'll just pause for a moment to see if there are any before moving on to the next item on the agenda. No, I don't think there are, so we'll note my report, and then I will move us on to ask Helen, as our new Chief Executive, to take us through her first formal Chief Executive report in that role. Helen.
Thank you, Chair, and thank you for your kind words. I've got just a short update report as the Chief Executive to highlight some of the issues and key things that we want the board to be aware of for April. So the first point is that we've successfully transitioned to Digital Health and Care Wales, as this board meeting testifies to. So we've got a project closure report that will be submitted to the DHCW Management Board for approval at its next meeting, and then that will be formally shared with the Special Health Authority Programme Board, which I believe will be happening in early July in terms of the formal closure of that transition project. We also now, following my appointment earlier this month, we can now move forward the process of agreeing the DHCW executive appointments, the remaining executive appointments and the wider senior leadership team. So we will be engaging the board fully in that process, and I'll be setting out a timeline with the board in order for us to achieve that as early as is practicable. We've also, on the agenda later, we'll be coming to the annual plan. Just to note, we have had a review session at the board development session in April. We have also had some very early feedback from Welsh Government that the plan was clear and concise and helpful in the development of the new SHA. We're awaiting further detailed feedback, but we will go through the detail of the plan later on the agenda for formal review and approval. In terms of strategic engagement, and you'll see that one of the key elements or key messages, sorry, that is coming across in our plan when we cover that later is the role that we have as a strategic partner for the wider health and care systems. We've been undertaking a number of strategic engagement sessions. We commenced those last year in preparation for drafting the annual plan, and we're now working through the timetable of those with the NHS Wales organisations in order to, with the objective of agreeing a joint plan between us and the local organisations. We're also engaging a partner in the development of our strategic engagement plan, and we will be working that through with the board in the near future. In terms of the COVID response, clearly the pandemic hasn't gone away and the digital requirements continue to emerge. There's almost been no let up in the requirements, as you would appreciate, really. So we are really the predominant ask of us as an organisation is in support of the Test, Trace, Protect programme and the National Vaccine programme in Wales. So we continue to work with Welsh Government on those priorities, that we are continuing to deliver those services and actually support the delivery of new and emerging priorities. In terms of the Cyber Resilience Unit, I'm really pleased to announce that we went live with the new Cyber Resilience Unit on the 1st of April. And this is a brand new unit for NHS Wales, and this is to fulfil the role in a delegated capacity of competent authority that Welsh Government has to discharge. So they've commissioned us to actually support the development of that and the work that needs to be supported to move that forward. So we're now the phase 1 of that programme of work was to establish the unit. We're now moving forward into phase 2, which is to develop the work plan and the activities that we need to develop the cyber posture for NHS Wales and work with the local organisations. Moving on to the data centre transition. So colleagues will be aware that we are moving out of one of our 2 data centres. The contract ends at the end of October. We have a board in place that is managing the transition plans. It's important to note, I think, that we've had to do a replanning exercise very recently, and I've got a recent update on that to provide to the board. So we've had delays in the network connectivity going in for the public sector broadband to go into the site in order for us to have the network connections that we need into NHS Wales. So that's necessitated a replan of the physical moves out of the data centre. That work has been ongoing over recent weeks, and I'm pleased to say that a revised plan has now been agreed at the Data Centre Transition Board, and those revised dates for physical moves will be shared with the wider service this week, actually, because that meeting actually happened yesterday. The revised plan is still on track for us to be able to exit the data centre by the end of October, contract end date. So the matters to note for the board are the ability now to progress the appointment of the 2 remaining executive director posts, and the delays that we've experienced, but also the replanning work that's gone on as part of the data centre transition project, and the ongoing response to the COVID pandemic work and the work with Welsh Government on really flexing our plan to be able to meet the emerging demands. Thank you, Chair.
Thank you, Helen. I'm sorry. Thank you, Helen. Some really important issues in there. I wanted to just pause and invite any questions from board members, and I can see, Sian, that you want to come in with a question.
Yeah, I have a couple of questions, Helen, and congratulations on your role. We're delighted to be working with you permanently now, which is great. So great news. You talked about the appointment of the executive directors. I'm very keen that we also understand the total organisational development review and the timelines to, as you now are setting up, what your plans are for the timeline. So that was one question. Of course, the ED positions are really critical within that. And then my second question was on the emerging requirements coming through for COVID, how your thoughts are, and perhaps something to think about, how we think about the governance of that in relation to the annual plan, because it will chop and change. So be interested to think about, you know, sort of the governance process for that, and how we can manage priorities and so on, especially with a very large agenda that DHCW has got anyway. Thank you.
Thank you, Sian. In terms of the moving forward with the broader kind of getting the structures in place and the broader development, so we're working through kind of a very detailed timeline of that I'm hoping to share over the coming weeks, with a view that we would by the end of June really have something more formal that we could work through with independent members and the wider board really. And I believe that we're looking to organise a remuneration and terms of service committee in order to kind of review that. And I think it's important, as you point out, it's not just about the appointment of the executive directors, it's about the broader kind of organisational development. So we'll make sure that that plan is part of that kind of formal update, if you like, but also that we will have had a chance perhaps to review that and for board members to be involved in the development over the coming weeks, really, as we aim for that timeline. In terms of the COVID response and the change in priorities, that will you know, inevitably actually that some of these things are new and emerging, that we've got in terms of the broader governance and the broader prioritisation of those. There is a TTP digital pathway group that I am co-chair of with Ivan Evans, who's the Director of Technology in Welsh Government, and that group reports into the TTP programme board. We also report into the specifics around the vaccine system into the vaccine board. So there is, as part of that, a prioritisation process, and that board has got kind of broad stakeholder involvement in it, so that we can work through how we're prioritising within those programmes of work. And then internally in DHCW, we've got the Planning and Performance Management Group, which is our internal mechanism for actually dealing with kind of requirements as they come in during the year, because it will happen, and it does happen, and how we then understand the priority of those things in relation to our planned activities, and if necessary then change control the plan.
Lovely, and thank you, Helen, and thank you, Chair.
Okay.
Thank you.
Thank you both. I can't see any other questions coming through at the moment from board members, Helen, in relation to your report. So I propose that the formality is noting your report, but clearly there are some really important issues in there that we will come back to as a board, particularly around the wider organisational structure issues. In that case, I'm going to move us on and welcome Michelle, our Chief Operating Officer, who is going to talk us through the DHCW annual plan. Helen, I wasn't sure if you were going to make any introductory comments before Michelle, or are we going straight to Michelle? I think Michelle, it's straight to you.
Straight to Michelle.
Straight to Michelle. That's fine. Just to note that for members of the public and stakeholders who are joining us today, we as a board, we have had an opportunity in one of our development sessions to go through the plan in detail, because it is a very comprehensive document, but it's important that we receive that formally. And really, I think just to sort of echo comments from that Sian and Helen picked up in terms of the last item on the agenda, we do have to recognise that we are operating in very uncertain times at the moment. It's not just about COVID. We've also got a new government. We will expect to see shortly, I'm assuming, the new programme for government. So we have to be, flexible in terms of what the organisation will need to respond to during the course of this next 12 months. But it is equally important that we have clarity for the organisation and for our wider stakeholders in terms of our direction of travel and the specific priorities that we're going to be working through during the course of the year. So without further ado, Michelle, I'm going to hand over to you, and you're going to take us through an overview presentation, I think, in terms of introducing this item.
Thank you, Chair, and good morning, everyone. Yes, I have the pleasure of presenting the plan for the approval of the board today. As Bob helpfully introduced there as our chair, we have had some time as a board to start to get into the detail of the plan. I think it is worth acknowledging, though, as a brand new organisation, perhaps the board hasn't had the level of opportunity that it would have had in normal circumstances, certainly to set the strategic direction of the plan. And that's because for practical purposes, really, we were required to submit a plan by the end of March in accordance with the Welsh Government Planning Framework. It has been very much developed and presented in accordance with that framework. And obviously our new board, I think, probably came into post at approximately the same time. So limited opportunity, but as the chair has helpfully pointed out, we do anticipate that the plan will be refined during the year. And that's something that we would expect to do anyway, and we would certainly expect to engage much more fully now with our board in terms of strategic direction and how we will move forward in future years. Probably the other point to note is it is an annual plan, and that is really, I think, a slight change in the Welsh Government requirements this year, really reflecting, again, as our chair pointed out, that it was an unusual year last year. It will potentially be an unusual year this year because of the pandemic situation. So rather than presenting a 3-year plan, as would normally be the case, this is an annual plan. We would anticipate going forwards as things move into more of a level playing field, perhaps, that we will return to the slightly longer term strategic planning, which I think is helpful. So we have got a few slides, as I say, which I thought would be helpful to perhaps guide board members and others through our approach to the plan. And as I say, we do recognise, and one of the key things, important things that we'll be doing once the plan is approved, is looking at how we can share the messaging and the key objectives and what we're seeking to achieve with a wide range of stakeholders. And we will need to do that in different ways in terms of the stakeholders that we are planning to engage with. So if we could move to the first slide, please. Yep, if we can move on to the next slide. There we are. Thank you, and thank you. I've got a person helping me with the presentation today, which is really great. So thank you, Kate. I do appreciate that. So just a quick review mentioned there in my introduction, and I think we thought it was helpful to perhaps share this little reminder of the context in which we were delivering our plan or developing our plan for this year. And that was my reflection on the unusual year. I'm not sure that really sums it up, but I'm sure it's been a challenging year for all of us, really. In terms of dealing with the COVID-19 pandemic. As a digital organisation, we were called upon to provide a range of support services to our frontline colleagues, and our predecessor organisation stepped up and was able to help, I think, quite a lot in terms of the organisation, in terms of the data, in terms of supporting, as I say, that response from those providing care at the front line. And that was very much the context in which we were developing our plan as we looked ahead to this year. As I said, again, in common with many of us, I think we're hoping that we will see things moving forward on the pandemic basis, and we will be able to focus our attention really working with our Health Board and Trust colleagues on what we may call recovery, or certainly stepping up more of the other services that the NHS provides, and supporting perhaps in a different way. And I think one of our reflections in developing the plan, we've learnt an awful lot in the last year, and actually the profile of digital has increased, and the pace of the adoption of some of the digital services has increased. I'd have to say largely through necessity, but it's created a momentum, and I know in common with many of our stakeholders, we are keen to maintain that momentum and to build on that, and to build on the advantages that being able to deliver services in a different way actually delivers. And we anticipate that will carry forward now as we move through the pandemic. So if we could move to the next slide. Okay, so probably, and I've touched on it clearly, but just to reiterate, the other key point in developing the plan was the exciting opportunity that the move to Digital Health and Care Wales presented for us as an organisation. So I'm talking, I guess, as part of a predecessor organisation, recognising that we are now very much in a new era, you know, for digital and for us, and that creates a great deal of opportunity, I think, and we've tried to reflect that in our plan going forward, in terms of the art of the possible, I guess, and the role of this organisation and why this organisation was established in order to drive forward the digital agenda for the health and care sector. So really exciting, and I hope you can see that in the plan. We were excited about the opportunities that presented for us. So as you would expect, a key focus on the plan in our role in terms of the ability for the service to transform the way in which care is provided, and that's really the key focus of our plan, and delivering modern and mobile services for both our stakeholders within the NHS and social care, but also increasingly to patients or members of the public. And I think that agenda, I hope you will see coming across strongly in the plan. It has been a key aspect of Welsh Government strategy in terms of the way it delivers health and care services to Wales, about empowering individuals to become true participants, or indeed to take control and manage their own health and well-being and the way in which they engage with the service. And we need to provision the tools in order to empower them and the data to support that transformation. It's also, you'll see a strong theme around data, so that is a key part of our role. It's data to support direct care, but also increasingly data to big picture, if you like, to underpin decisions about the way in which services are delivered. We saw that loud and clear in COVID. I think we all got used to seeing the daily updates or the weekly updates from ministers and from other key figures reporting on in a very transparent way to the public, as we would expect, the progress of the pandemic and our response to that. A lot of that data was coming from this organisation, I'm proud to say, and it reflects one of the ways in which we support both Welsh Government and, again, the health and social care sector in informing the way in which healthcare services are delivered across Wales. And we very much, you will see in the plan, I hope, where we are building on many of the achievements that have been made to date, and I will talk a little bit more about that as we move forward. But the digital health and care record, again, a key aspect of the plan, and the really firm foundations that have been built in terms of the delivery of that service. We will certainly be seeking to build on those and really maximise on the benefits that can be delivered. Next slide, please. So what does that mean? So what can you see if you open the pages and you start to look through the plan, and I hope that many people will. So I've just broken this down a little bit. We'll have touched on some of that in my introduction. It's very much about supporting frontline staff. That's what we do, and we work very closely with the other stakeholders, if you like, in the delivery of health and care, and we provide services very much to underpin and support the transformation of that care. And the key points here, and you'll see it in terms of those providing care and those receiving, that is wherever that is needed. So that is trying to break down kind of geographical and organisational boundaries. I often think as a patient, we don't necessarily even see the organisational boundaries when we're receiving care, but very much in terms of the way services are structured. I think in the past that has created some challenges, and we're working really hard to work across those boundaries. It's about delivering new digital solutions to those providing care. So you will see in the plan particular themes around cancer. This is a key area, and we're replacing a legacy system with new solutions and new support for those delivering cancer care, which is absolutely key. Agenda to help the nurses, a kind of key and quite a significant component of those who work in the NHS, certainly are our nurses. And I'm really pleased to say that we are driving forward with the digital nursing record across Wales now, and it's already in implementation across Wales. To support nurses who spend an awful lot of their time, I'm sure if you spoke to them, collecting information, again, if you're on the other side of that, being asked repeatedly for information about yourself and about your care, which is quite frustrating and very time consuming for those providing that care. So this is about capturing information in an efficient way and making that available to those who need it securely and safely, of course. Particular focus on critical care. So again, critical care very much in our minds as we've come through the pandemic, and the support that they provided for those who became very ill as a result. It's a key service, permanently, regardless of where we are with the pandemic, and it's one that perhaps isn't quite as run as in the way that we would hope to date. So lots of machinery and devices supporting the patient in critical care, but often that results in the production of pieces of paper, frankly, and still very much a paper record in critical care. So we've Welsh Government have invested in a new solution, and that will roll out this year. So that's absolutely key. We're also updating hospital pharmacy. Again, you'll see that in the plan. 3 of our health boards are now live on the new hospital pharmacy system. So this is the stock control system in use. I think we're replacing a system there that's circa 30 years old, so probably well past its sell-by date in terms of use of that system. But we anticipate that this will provide a firm foundation from then to build up to other areas of great benefit in this area, including things like e-prescribing. And I think that's an agenda we will be increasingly discussing. And not to forget, obviously, the community care. So this was a groundbreaking solution when we procured and started the implementation, which is a truly shared care system across health and social care, and very much about reflecting the way in which support is provided to the citizens of Wales and ensuring that we can do that in a way that is joined up and really informed. And some key successes with that solution to date, and we will continue the rollout of that solution this year. I touched on it earlier, so I won't repeat myself, hopefully, in terms of empowering individuals, really, and that is very much the focus of the Welsh Government strategy in terms of the way in which we provide health and care to the citizens of Wales, both in helping them to recover from illness, but increasingly to take control of their own health and well-being. And to empower individuals to be true participants and indeed to lead where appropriate in terms of their expectations of their own health and well-being. Really important agenda and good progress being made, I'm pleased to say, on that, and a key part of our plan this year. touched on COVID-19, and our Chief Executive in her update also mentioned that. Of course, that hasn't gone away, although the situation is improving, and we anticipate that we will continue to deliver digital services in support of our colleagues' response. And as I mentioned earlier, particularly now the shift to recovery and how we can support different ways of providing support as we come through the pandemic. I've talked a lot, I think, about using data. The Chief Executive mentioned again in her update, you've stolen some of my lines, Helen, the standing up of the Cyber Resilience Unit, again, a key service and key, I think, in our underlying agenda, which is very important. In terms of security, the security of the data that we hold on behalf of the citizens of Wales is really important to us, and as an ongoing challenge, I think, and we put a lot of focus and resource into ensuring that the data is safe. Standards alongside that, not the most exciting, I sometimes think, in terms of the agenda, but digital standards are the way that we are able to deliver quite a lot of the benefit and the service that we need to across the healthcare sector, and they will continue to be a key focus for us. And obviously then the new data centre. So our move from what is a legacy data centre that we've been in for about 10 years now, and increasingly to the use of cloud, is quite a significant move for us, and will have a significant impact on our resources this year. The one I didn't skip, honestly, I'm coming back intentionally to the blue box at the top, because this is again a really key one that we've drawn out here. Talking about our strategy, you'll see a lot, I think, or a strand through the plan about opening up the architecture. I always think that was interesting, and the way in which we can provide data. But what that's really about is reviewing, re-examining and refreshing our strategy, really, in terms of the way in which we deliver solutions in a more modern, agile and open way, which really opens up our ability to work with partners, to work in a more flexible way, and to meet many of the objectives that we've set for ourselves as we move forward. So next slide, please. So what does that mean? I guess I could kind of wrap all that up in the vision that you will hopefully see rising from the plan, which is really about that kind of underpinning that digital solutions and services to support better care and outcomes for the people of Wales. And that is really that's what motivates us, I think, as an organisation, and that's very much how our plan has been developed. Providing those, supporting better outcomes, and really the use of data and information to support both decision making and the provision of care. Next slide. And reflected again in our ambition, and I will have touched on these things. I will be in danger of repeating myself. So opening up our architecture, really key. And for those who are familiar, the architecture review that was undertaken, this was a key aspect or a key recommendation arising, and a focus that we've had actually for a number of years, but that we would expect would step up this year, supporting the modernisation of the delivery of care with new digital solutions and services and data, really about empowering our staff and patients and citizens, of course, across Wales, in terms of the way in which they engage with the NHS and with the care sector, and ensuring that we really get value from all of that data. So we collect an awful lot of data across between all of our stakeholders, and it's really about maximising the use of that data in terms of our decision making, as well as our direct delivery of care. Take the next slide. Again, Helen mentioned this in her Chief Exec briefing. We work very closely with a broad range of partners, and many of our key kind of partners we've tried to set out on this slide. We work with them in the development of our plan, and we will continue to work with them in terms of the delivery of our plan. I often think the services that we deliver aren't really for our benefit as an organisation, they're for the benefit of our partners, and clearly we need to ensure that those benefits are being received and are the right things for the wide range of stakeholders in terms of their priorities and what they need to achieve as a service as we move forward. On the right hand side of the slide there, I was just setting, I did give a brief nod, I think, to the longer term strategy, and this is certainly something that we would expect to be engaging with the board with now as we move forward. We've set out, I think, clearly in our plan what we're seeking to achieve in this year, in the annual plan. But as we move forward, it will be really clearly to capitalise on those investments, those foundations, to ensure that we really are getting to the benefits. You know, they're opening up the architecture, ensuring that we can work in a much more kind of agile, flexible and interoperable way. We need to just, you know, really then focus on the so what, isn't it? So what are the benefits that will open up for us, and how do we make sure that we're maximising those benefits for this investment? I think it's a similar issue for the kind of cloud first. The cloud first is very definitely the Welsh Government strategy, and we would agree with that. And we will be developing our own strategy in terms of how we move increasingly to cloud. But I think we need to be clear about why we're doing that, the benefits of doing that, and again making sure over time that we really maximise those benefits. And likewise with the whole value from data that I've touched on, there is a lot more that we can do in these areas, and I think the components or the objectives in our plan will certainly move us in the direction that we need to in order to really maximise those benefits. Next slide. So I'll just run through really quickly because I probably have touched on this category, and this is pointing to the sections in the plan really. So our 4 kind of strategic objectives that you will see in the plan. I'm just going to run through those now at a high level. So the first one, really, we think of these as enablers. Really, these are the foundations to the other areas of benefit that we want to deliver. So I touched on this is about you know, defining our strategy in terms of the architecture. It's about making sure data follows the patient, not the organisation necessarily, and it's about sharing data. And doing that in a way that the citizens of Wales are comfortable and confident with. So we'll be working with Welsh Government on that, and you'll see it in the plan. We talk about the information governance framework. I think the term data promise is used, which is quite a good way to sum up perhaps the work in this area, which is our promise to the citizens of Wales in terms of and our plan to engage with the citizens of Wales as a wider sector in terms of how we capture their data and how we will look after it and use that data for the benefit of the citizens of Wales. And we recognise, as do Welsh Government and our other partners in this, the importance of bringing citizens with us and for individuals to really understand and own the way in which their data is used, not least being able to access that data themselves so that they can use that in the ways that they see fit. And underlying that, obviously, there's an ongoing programme of updating our old and legacy infrastructure, and part of that, as I mentioned earlier, is around the move to cloud. So if you're navigating through the plan, you'll see I'm talking about the bottom line of the triangle on the right hand side. If that's right, I'm going to just briefly run through the other key lines. If we can move to the next slide. So again, I won't repeat it. I've talked about the digital services. I've included some examples. In terms of the plan, the way that we've organised the plan, or we've set out the plan, is in line with the way in which I think individuals perhaps interact with the NHS, and certainly the way in which the policy and direction from Welsh Government works. So we've got, you know, public health, primary community, diagnostics, planned and unscheduled care, and medicines management. So that probably is about the way in which we organise ourselves as a sector, but hopefully in the plan you can see, and in our communications, what that means for real people, and how we were proposing to help both the healthcare professionals in delivering care as well as individuals. Next slide. So again, I've talked about this very much, the strand, and very much how we see the success of in the delivery of care across the sector is really, and our role in that is about empowering both those who deliver and those who receive or manage their own health and well-being as we move forward, and being able to do that in a trusted way and an accessible way and in a personalised way. So this is about care that fits an individual. And again, that is very much the healthcare strategy in Wales, in terms of maximising the benefits at a very individual level and managing our own health and well-being. And I like the point at the end, how fabulous it would be in many other sectors. We can manage an awful lot from our phones now. I'd certainly like to be able to see access information that the NHS holds about me, and I'd like to do it in a way which suits other aspects of my life, and that is very much the agenda that we are moving forward with this year. Next slide. I have a couple more, I think. Yep. So last but not least, so the national data resource, you'll see that coming through in the plan. That really, I think, encapsulates the programme of work around being able to pull together the wide range of data that is collected and making that available in a timely and accessible way wherever that data is needed. I've vastly simplified that programme. It is a big programme of work, and a really key programme of work, and one in which I know we work very closely with a wide range of stakeholders, certainly the health boards and trusts, who are very keen to work with us and to be able to benefit from the opportunities that will create for us as we move forward. And yes, making sure the architecture is in place so that data can flow, and it can flow through the existing systems and through the new digital systems that we are putting in place. Next slide. Yep, so to help to navigate through the plan, hopefully it will help, and we'll be looking at this again in terms of the performance report. We have come up with this, what we're calling our plan on a page. There is quite a lot in the plan. It's a complex delivery, and what this is really highlighting are the kind of key milestone deliverables, really, and those we anticipate will have a significant impact in terms of our stakeholders. So we've tried to capture these in a simple way on a one page. To both explain what we're seeking to deliver this year, and also as a board, we will use this, if the board are happy with that, as our mechanism for capturing progress. So whether we're on track, we will see that a bit later in the agenda in terms of the performance report, where we are in terms of our intentions and the key deliverables in the plan that we are anticipating. And I've talked about a number of those already. I'm very pleased to say we've already achieved the cyber resilience unit, so that's a good start in Q1. It's early days, but there's a lot of progress that we'll be picking up on the performance report. Next slide. So just a quick one in terms of the way that the plan works, and I think helpful to highlight, and often we've been quite rightly asked, it's a balanced plan. We have the things that we've put in our plan are funded and resourced, in the sense that we have a kind of core underlying revenue position, and our Director of Finance will have covered this both in the first and I'm sure today and future boards. We have an underlying funding position which comes from a combination of Welsh Government and from some of our stakeholders in terms of the services that use. That in principle funds the running of the organisation and the development of the services that we offer. We've got about 800 staff on our establishment that also deliver those services, and about 100 products and services. If I sound like I'm being vague there, it does move around a little bit, and that's quite a wide range of services in our service catalogue. We also then, when we formulate the plan, we recognise that there is the opportunity for additional funding to take forward specific initiatives. So on the right hand side there, in terms of the financing, you can see that we anticipate receiving income from the Digital Prioritisation Investment Fund. So that's a specific Welsh Government fund that has been set up to drive forward digital innovation, which is very much something that we are involved in, and we're anticipating there about £18 million worth of revenue. So that's a significant investment from Welsh Government in terms of some of the new initiatives we want to take forward. We do receive income in relation to COVID. So again, there's specific funds available through Welsh Government to support the management of the pandemic. And we will receive some of that funding in order to underpin the services that we are providing. And we also receive a capital allocation, so that's sort of one-off expenditure really for assets, and that comes both from the Digital Prioritisation Fund, and we also receive a discretionary capital allocation. Again, I'm sure our Director of Finance will be will be taking us through the detail of that as we move forward. And what does that mean? That means we were able to deliver some additional services over and above our core, if you like. You can see those in the delivery projection. So there's some of those areas that you will see in the plan that we are able to take forward this year because we have had some additional funding coming into the organisation, and that also means that we will increase our staffing levels, so we'll get more people on board because we are largely a people organisation in terms of delivering all of the services that we deliver. So in our first 2 quarters of the plan, we anticipate that we would need approximately 90 additional staff. Now that may be through recruitment, but also we will look at other means to resource. So we won't necessarily recruit all of those people into our organisation. We look at more flexible and agile ways of doing that, including partnerships with commercial partners who can obviously add a lot of benefit and potentially contribute in ways that we can't or wouldn't wish to as an organisation ourselves. Next slide. So inevitably there are risks to our plan, and I think when Sian has already raised one in her question this morning to this board. So new requirements coming in, we saw a significant impact of COVID. It was unexpected last year, wasn't it, to a large degree, in terms of the response. I think we are in a more planned status now, but never say never, she says carefully. We do anticipate that there will be new requirements arising. We have, been able to kind of solidify that team and look at ring-fence resources to support this particular area of work so that it doesn't have such a big impact on other areas of the organisation. But, I anticipate that we may well see movement, and we may well need to flex as we move forward this year with our plan, as the rest of the service may need to flex as in terms of their support. We obviously have quite a significant amount of the plan, which is about moving away from legacy, both legacy infrastructure and legacy applications. There are some risks in that, I think, and the pace in which that we are planning to do that. One of those is in delays. So I talked about additional income coming in. There will be some additional business cases we anticipate putting forward to Welsh Government to support the infrastructure investment. And obviously we're hopeful that we can agree those in a timely way to make those developments. I touched on recruitment and our people and some of the challenges, and I think I'm going to pick that up a bit later on the performance aspect of the agenda. But that's obviously key, being able to recruit the right people to come and work with us. But also, I think, as I mentioned, to find the right partners to work with us as we move forward. I touched on CANISC is the name of the legacy cancer system, and you'll see the replacement plan again, key deliverables, and one of the areas there, obviously, again, we are delivering digital solutions into a cancer delivery environment and working with our partners. And the ability of partners in Bwrdd and across the health sector to work with us and to be actively involved in that process. Their capacity and their availability is obviously key, and we're very mindful of that as we move forward. Contractual delays, unfortunately, we do sometimes experience delays in terms of our commercial agreements, and a number of areas of our plan are underpinned by agreements with the commercial sector. We manage those very closely, but we are dependent on commercial partners delivering in accordance with our contractual agreements. And I touched on the IG framework, or the data promise that I mentioned earlier. This is a really important piece of work. We are working closely with Welsh Government and other stakeholders to move this forward, and this is key that we can reach agreement on this point, and that citizens are comfortable with the approach. That's really key to the opening up and the wider use of data that I've mentioned a number of times as I've gone through the plan. So I have, I think, 2 more slides, I think, Kate, if we can move to the next one. Thank you. So I'm gonna kind of finish where I started, really, perhaps, and reflect on the new organisation. So you will see in the plan a key focus for us as an organisation and as a board is how we want to take ourselves forward, really, and how we will make changes to the organisation and capitalise on the opportunities that are presented to us. So we'll start with perhaps our new the governance, the board itself, the leadership roles, and the way in which we want to work with our whole organisation, really, as we move forward. We are certainly working very hard at strengthening stakeholder relationships, and that will be key for all of us as we move forward. And again, the Chief Exec mentioned our stakeholder engagement strategy, and that's something that we're very keen to move forward with the board in the coming months. The strategic roadmap is key, so I've mentioned strategy a number of times, as you probably would expect, I hope, in terms of the plan, and also, as well as the overall strategy, I think there's also the roadmaps for each of our individual products, which obviously will need to sit underneath the overall strategy. So we look forward to working with the board on those, and of course our wider stakeholders as we progress. Quality regulation, service improvement, absolutely key in terms of the way we operate as an organisation, and we will certainly be talking about those more, and those I hope you can see coming across loud and clear in our plan and in our intentions. And I've talked a number of times about our people, absolutely critical in terms of how we can build on our capability and capacity. So next slide, Kate. Yeah, so next slide, you'll be pleased to hear, is my last slide. In terms of the next steps, I can see that we've got a number of questions people are keen to ask. So we're presenting the plan for the approval of the board today, which we would appreciate, and that obviously the plan sets the context for our own organisation in terms of what we are asking our people to deliver, and also is the key basis for engaging with our wider stakeholders. Again, the Chief Executive mentioned we haven't received our formal feedback from Welsh Government. We would expect that, and that feedback is provided to all organisations who've submitted their plans. So again, we will need to take that on board as and when it is received, and that may require further refinements to the plan. And I've talked a lot, I hope, about stakeholder engagement. That will be absolutely key in terms of the way that we share our plan and the way in which we engage on this going forwards. Thank you.
Thank you, Michelle, for a very comprehensive presentation in a sense of both how we have developed the plan, how it sits in the sort of wider context for us. But I think hopefully giving people who are less familiar with it than those of us around the board table a sense of how that plan takes us from that kind of high level vision through to the very practical things that will be delivered during the course of this year. And as you say, I think it's important to emphasise that what we have here is a plan that is costed and we believe to be deliverable during the course of this year, but also recognising that as a new organisation and a new board, I think you alluded to this, Michelle, that we have a lot of work to do as a board. The development of the long-term strategy for the organisation is a critical function of the board. So this is something which is a start of a process for me, not the end of it, really. I think in terms of how DHCW begins to shape the longer-term future and set out more clearly our role in the long-term development of health and care in Wales. So thank you for that. I've got, I think, half a dozen questions at least lined up. So I will make sure that I get through those before we move on to the next item. Grace, I think you wanted to ask a question. I've got you up first.
That's right. Thank you, Chair. So I have 2 points on the plan. Firstly, it's great to see the plan being person-centred and really clearly linked to the people, the health professionals and the citizens and so forth, especially with the images that are now there. And what I'm wondering, and generally with the plan, can we make sure that we emphasise a link to care as well as to health? That's something which I think is important, particularly as we are in digital health and care Wales, and care can often be missed somewhat in these discussions. And secondly, I'm wondering if it's possible to make sure that we emphasise engagement, and whatever that looks like, noting that we are a national organisation, so we will be thinking how we will engage around Wales, and how we engage both vertically and horizontally, so how we engage with other organisations. And I know, for example, Social Care Wales and Health Education Inspectorate Wales, for example, have had joint workings and joint plans, and so just thinking, you know, how we are going to be looking out alongside other organisations similar to ourselves, as well as working both with government and with citizens and health professionals. Thank you.
Thank you, Grace. I'm not sure if Michelle, if you want to respond, or Helen indeed want to come in on any of the points that Grace has raised. Michelle?
Yes, thank you, Grace. I would wholeheartedly agree with you, and we need to make sure that that comes across clearly, doesn't it? Because yes, you're right. Our agenda is not just health. It is very much health and care and well-being. I think increasingly as we move forward, and again, citizens don't necessarily distinguish between those things. Those are organisational rather than reality boundaries. We have had. We've had some really helpful engagement already, certainly with Social Care Wales, in terms of how we can work together more effectively, and initiatives such as the community system, which is already crossing boundaries, and the benefits we can see coming out of that. You're absolutely right. But I pick up your points. And in our stakeholder engagement strategy, I think we need to explore all of those permutations, don't we, and make sure that we've got, the right level, and that we're engaging with a wide variety of stakeholders. Absolutely right, because that's how we'll deliver benefit, isn't it? So yes, absolutely agree. Thank you, Grace.
Am I live?
Oh, I think it's come to me, Chair.
Sorry, colleagues, and those who are watching us, this, as I said, there will be some odd pauses as we try and move the live feed around, and you'll probably see me mouthing words from time to time and not being able to hear me. Anyway, Helen, I think you wanted just to sort of come back in on Grace's questions before I move us on to David.
Yes, apologies. Yes, thank you. Yeah, Grace, in terms of the specific kind of reference to care, I think that's really important, and we will make sure that that is brought into the fore, if you like, if that's not already coming through in the plan, and particularly the emphasis on the engagement piece there. So in terms of the joint working, as Michelle said, we've already got strong relationships in place with Social Care Wales colleagues, actually, and we'd be looking to develop a memorandum of understanding with Social Care Wales in terms of really setting out how we will support and work as strategic partners together. Really, lots of really good work in the National Data Resource Programme, actually, where we've kind of, social care is absolutely a key player in the objectives that we're trying to achieve through that programme. So thank you.
Thanks, Helen. I'm going to move us on now to David Selway. David, hopefully you'll go live in a sec. I think you're live.
Thank you, Chair. It's an observation. Thanks, Michelle, for the summary of the plan. Very good. Around the value from data, I see that as a key enabler for what we're doing going forward, and I think it would be helpful, beneficial to the organisation if we could develop some sort of methodology to measure that and to be able to report on the success of our digital services. There is no off-the-shelf, easy-to-use methodology there, so it's something that we will need to work on and to develop. And maybe we can collaborate with the Value-Based Healthcare Initiative and the POMS programme at the moment to try and come up with a way of doing that.
Thanks, David. I'm not going to plan to sort of draw others in on that one. I think, as you say, it was for observation, other than to note that we've, unless either Helen or Michelle really wants to, but to note that we've obviously got, I think, our next board development session, we've got time set aside to pick up some of the discussion around value-based healthcare as well, so that we can link into that conversation at that point. Okay, thank you. I think it's Rowan next.
Thank you, Chair. And Michelle, can I just say kudos for simplifying a very detailed plan and bringing some real energy and a coherent thread through that presentation. That was a great job. You touched on digital standards, open digital standards, and reflected on standards not being the most exciting thing, but I think they're incredibly exciting in terms of enabling this organisation to deliver what, you know, on its ambition and its contract really with Welsh Government and the citizens of Wales. And we talked about engagement, and I know through the conversations that we've had over the last 7 weeks that the organisation now has a chair around the table and is engaging with its near and direct stakeholders, if you like, in the NHS in Wales. But for the audience that might be listening to this board meeting, members of the general public whose opinions are critical if we are able to unlock the value of data and meet their healthcare needs and wellness, and perhaps the wider foundational economy opportunities that presents. How could citizens in Wales engage with DHCW today, or how can we plan to develop a channel for citizens of Wales to engage with this new organisation and share their concerns and hopes for control of their health going forward? Big question. Thank you.
I think we'll go. Oh, I'm back on live again. Just in terms of how we handle this, because when we get quite a few questions, it can get a bit clunky as we work our way through. What I will assume is that the first person we go to after a question has been asked is the person who's presented the report. So in this case, Michelle. And then after Michelle, I will automatically draw Helen in if there's anything that Helen wants to do. But so rather than coming back through me as the link, if we just go sort of straight to Michelle and then Helen, and then hopefully that'll move a bit smoother. So Michelle, do you want to come in and just respond to Rowan's big question, as she says at the end?
Yes, well, a couple of points, and thank you. Firstly, thank you, Rowan. I have to give credit to my team. I'm afraid it's not me, particularly the planning team, who've done a fantastic job, and will continue to as we move forward across the organisation. So I really appreciate that. I get to stand up today, but it's very much a team game in terms of delivery. So a couple of things. Apologies if I accidentally insulted any colleagues who are involved in the standards area. I guess in my mind, my thinking was that it's more difficult to see a tangible deliverable. It's not like a new system or a new service. It's actually, but I think we would all agree, absolutely fundamental. And Helen may well want to come in on that as well. And then on your wider point, again, yes, I mean, clearly our agenda is about supporting citizens, and therefore engaging with citizens has got to be the obvious point, isn't it? We shouldn't be complacent or so arrogant to believe that we understand what all of the citizens of Wales want and or need. We often say that we are citizens, we are patients, but we can channel our own views, but that is not the same as engaging and taking on wider views. And I think I'll be totally honest, and again, Helen may want to come in. I think this is an area where we are definitely shifting our focus now. So we have, we have our website, we have social media, we are trying to share and publish and engage. It's probably, to be honest, in terms of us putting out things, and we do get quite a lot of engagement. We do get queries coming in, and we do follow those up. I think as we move forward, and particularly this year with the digital solutions, specifically aimed toward citizens, we really need to ramp up in that area and really focus on how we can engage effectively. And again, I shouldn't, I wouldn't want to give the impression we don't engage at all. We do have, we do have groups, we do have certainly, representatives from various sectors or interest groups. But in terms of the wider engagement, both in terms of the things like the data promise and also the solutions or services, I think is something that we will certainly want to focus on this year. I would agree. I don't know if Helen, you wanted to add anything on that.
Thank you, Michelle. Yes, picking up on the standards piece to start with. Actually, no, I'm one of the people who do think standards are exciting, Rowan, so I'm probably in your camp there. But I think hopefully what comes through quite clearly in the plan is that focus on standards and opening up the architecture, and that focus on the architectural building blocks that will be, key focus and kind of the cornerstone of the National Data Resource Programme, and how we actually kind of ensure that we have a data-driven architecture for the single record and the digital health and care record in Wales. And in terms of, actually, Michelle's covered, I think, around the patient-facing stuff. There's a key programme, that's a flagship programme actually, around digital services for patients and the public, and how we will engage digitally now more with patients and citizens going forward. So a key year actually for that, and part of that kind of programme structure is that we will have kind of active involvement in the voice of the patient in that. But clearly, as our own organisation, I think there is more that we could do, and really, I think as a board, we could share some ideas of how we think we could be taking that forward as part of our engagement strategy and plan. Thank you.
Excellent. Thanks very much for that. And again, I think to remind board members, our next board development session, we've got a big chunk of time set aside to have a discussion around this whole area of engagement and how we move forward around that with our stakeholders. I think I've got one.
Just for the sort of public record, just to ensure that people are aware that part of that is also going to need to be including the citizens who perhaps are not digitally enabled today.
Absolutely.
To benefit from that.
Absolutely, I couldn't agree more. And there's something, I mean, I would, I use the phrase sort of metaphorically, but we need to get the organisation on the road and get out there, depending on what we can do and the ways in which we can do that with restrictions. But as things ease up and allow, I want, Digital Healthcare Wales to have a very visible public face, and to be getting out to talk to everybody, irrespective of how we do that. So absolute commitment, yes. I think I've got one final question from board member, from Marion.
Diolch, Cadeirydd. Thank you, Chair, and thank you, Michelle, for the clarity and transparency in that excellent presentation. Really well executed. Now, I've got a couple of questions arising specifically from the deliverables you've highlighted at the end of the plan. I'll start specifically with the Welsh Community Care Information System. Now, as you know, there's a lot of interest in the system across Wales, but as you've quite rightly pointed out, this is an annual plan as opposed to a 3-year plan, and clearly we are facing a lot of uncertainty as we arise out of the COVID pandemic. But I just wondered, could you possibly give us some clarity around the potential implementation of WCCIS across the health boards in Wales? It's in Powys already. There are 6 other health boards. When can we expect to see that implementation, or are you able to give us that? That's my first question.
Thank you, Marion. If you don't mind, I was going to ask Helen if because of the profile of the community programme, Helen is actually our strategic lead on the leadership board for community. So Helen, you may want to provide a response on that. Thank you, Marion.
Thank you, Michelle. Yes, so we're actually live in Hywel Dda Health Board as well, with WCCIS as well as Powys, so 2 other health boards. And in terms of the plans going forward, a number of the health boards are actually in their detailed planning phases and working closely with the programme on either what that plan and date looks like, or on taking the local business cases for the transformation programme to support WCCIS rollout through their board structures. So quite happy to provide kind of the detail outline plan for some of that stuff, but actually a lot of it is not date set as yet, but in terms of the planning process is well and truly kind of happening out there in the local organisations at the moment. So happy to provide the detail, Marion.
Thank you, Helen. And my second question relates to the Welsh patient administration system. Now, you've talked about the risks to the plan, the delays in infrastructure and contractual delays potentially. Now, I note, and it's a very welcome schedule in terms of implementing WPAS in the northwest of Wales, completing that final piece of the jigsaw. Now, those involved are very much aware of the long and complex journey that this has taken, and there have been significant challenges along the road. It would be helpful to know perhaps what's the level of confidence that you can give us in terms of the delivery. Will it be according to time and per plan? Thank you.
Thank you, Marion. I was going to say again, Helen, did you want to take that one? Thank you.
I can see Helen waving.
Yeah, thank you. Yeah, thank you, Marion. Actually, I've got an update that from yesterday's discussions. Actually, that's why I was waving. In fairness to Michelle, we've got where we recognise the critical importance actually of getting to single instance of the patient administration system at the local health boards, and the plan that BCU are really wanting to push forward with. So we've got now joint sessions in place between our organisation, BCU, and Bwrdd NHS Trust, because Bwrdd NHS Trust is the next implementation, and then BCU West will be immediately following that. But we got a joint oversight group, and we met just yesterday actually. So what's happening now is we've got preliminary work already happening with BCU. So lots of the standardisation, data quality testing work is actually underway already. The plan is tight. It is on the critical path, but as we are at the moment, we're on track, and we've got the mechanisms in place to manage that tightly. But we're doing it as a collective endeavour in terms of management of that plan. So as it stands, we're on track, but critical things happening. So we've got regular checkpoints in, and I think a catch up in a couple of weeks' time actually with our colleagues in those other organisations just to assess the critical path. So we're keeping a close eye on it.
Yeah, Kamal.
Thank you, Marion, for the question, and Helen for the response. Actually, I think I've got one more question from Sian, I think, on the plan before I move us on. So can I, Sian?
Yeah, diolch, Cadeirydd, diolch, Bob. Just a quick observation for me. I think I think it's a great plan, and Michelle, congratulations on the summary. It's been very well presented from a summary perspective. I have one observation. How do we know we're successful? And it's something we probably as a board should be working on in the next development session, but I really think we need to add in a slide here on, or a part of this, to say, how do we think we're successful? Because stakeholder management 100% agree, but we also then need to say to the stakeholders what we've done and what we haven't done and where the risks are. And I think that's incredibly important as a board, that we develop that progress report for our stakeholders, but also to hold ourselves accountable that things either get delivered or we understand the problems if they're not delivered. But from a patient or a clinician, how do they know that DHCW have done what they said they were going to do and that the vision is actually implemented? So I think a big part for us as a board to think about that.
Okay. Michelle, did you want to comment? Sorry, Michelle, do you want to comment? There you go.
Yes, thank you, Chair. Absolutely, I would agree with you, Sean, and I think there are two aspects to success, aren't there? I think I mentioned it when I was presenting the plan, that the services that we deploy are not really for our benefit, actually. They're actually, the benefits are enjoyed, or hopefully, in the wider sector. And ultimately, as you say, I made the point that our focus is about improving the delivery of care for citizens. So how can we trace what we do to that actual benefit at the end of the line? And I think that is really important. And I think you're right, you mentioned it. We need to work with our stakeholders. We need to really understand about the transformation, if you like, in care that they are seeking to deliver, what their kind of key drivers are and the benefits that they anticipate that could be achieved through the use of these new digital services, or the wider use of existing services, in fact, and that we can show that traceability back. So success in terms of, yes, we rolled out the pharmacy system and that was marvellous, and that was kind of the milestone for us, and well done us. But what did that mean at the other end? Did that then deliver the benefit that they were anticipating within the health board? And then, you know, did that then flow through to a benefit for citizens? And hands up, that's much more difficult than the first deliverable, but I would agree with you, and I think that's very much where we want to get to, working with our stakeholders and our board, and indeed the other boards, to understand that that is the difference that we're actually making, and that is the actual test of success of our plan. So that's work in progress, in all honesty, in terms of how we can really capture that and really share that and be transparent about that more widely, but it's something that we are very keen to take forward.
Diolch, Michelle.
Excellent, thank you, Michelle, and thank you everybody for the input on that agenda item. We've gone a bit over time in terms of where we're at there, so I'll need to just do a bit of adjustment in terms of our plan. But can I assume, therefore, that in terms of the formality of today, the board is approving the plan? The annual plan up to 31st of March next year. The caveat, as we've said all the way through this, is subject to detailed comments coming back from Welsh Government, and recognising the fluidity and flexibility of the environment that we're operating in at the moment, that there may need to be a need for adaptation and review during the course of the year. But so in approving the plan, Michelle, can I just add my words of thanks to you, the whole team, Helen, and the whole of the senior team, as well as all the people who've supported the development of the plan and so on. Fantastic job, and I think it gives us a really good framework for the year ahead, and helps us greatly, I think, in terms of the conversations that we do need to have with stakeholders about the practical things that we're actually doing to make a difference out there in the service. So thank you for that. I'm very conscious that you've been on the spot for the last sort of 45-50 minutes or so, Michelle, but I am going to try and get us through, if I can, the strategic procurement report, and then I think we'll take a comfort break when we've done that agenda item and just sort of shuffle that around a little bit, and I'll come back to item 4.3 when we've done that. So if it's okay with you, Michelle, can I go straight back to you in terms of the report? So we've got a specific here today in terms of the need for the board to approve, if it feels able to, a specific contract award, but also a paper which is just sort of setting out for us some of the strategic procurements which we are anticipating coming through the organisation this year, and which will need board input under our standing orders and SFI. So Michelle, over to you.
Thank you, Bob. I'm going to do a quick change, then I'm going to put my commercial hat on, and we're going to change tack a little bit, as Bob has said. So I'm pointing your attention to item 4.2 in your papers. So there's a cover report and two appendices, and I'm just going to talk through those as the chair has pointed out there. The first for information, the second for approval. So I will just walk us through those briefly, and of course happy to take any questions. So as I've explained in the cover report, I anticipate bringing procurement reports to this board and that is for both to keep the board up to speed in terms of key activity within the organisation, but also importantly under standing orders and standing financial instructions, any contracts that we're proposing to award over the delegated limit for the Chief Executive, which is £750,000, excluding VAT to be precise, they require the approval of this board. So I would expect to bring papers to this board in the event that we were seeking approval to award a particular contract, and as Bob mentioned, we have one of those in our papers today. So the first appendix, if you like, so I think that's 4.21 in your papers that you may wish to look at, is really for information to the board then to say, well, these are the contracts that we've identified in the plan that we were just looking at to date, that we would anticipate bringing to this board, so that you can start to become more familiar with the type of procurement activity that we're running in the organisation. We do have a whole range of procurements that we undertake, but these are the strategic contracts that we anticipate bringing to this board particularly. So there is a bit of a schedule there that for the board's information, and one of those, I'm just pulling up my own version of the schedule, you will note at the top is the second appendix that we're going to look at today. So I wasn't necessarily going to delve too much into the detail. This is really for information. Just a couple of comments that I wanted to make for clarity. If some of you were kind of eyes widening at some of the indicative contract values, those are very much indicative values. So obviously, you know, obvious to say, but procurements have not been run, and therefore we don't have actual contract values. So, and some of those are certainly the highest level of anticipated expenditure. So if you look, for example, at the GP systems, we actually plan to award a framework. So it's likely to be a multi-supplier framework under which health boards call off GP system contracts to support the GP practices across Wales. That framework, we've built quite a bit of flexibility into the way that we're running that procurement, so that it's a 5-year framework, and potentially we could have 2 call-offs during the term of the framework, which takes it to a real maximum term. That's not committed, so that would purely be a reflection of where we are in terms of the provision of services at that point. So it's a vehicle really which will enable us to call off if indeed we believe that that's the right thing to do at that point, or the health boards believe that that's what they want to do at that point. But we put, from a procurement value, we put the maximum possible values. Probably the other one that stands out is the Microsoft agreement. Now there's a couple at the bottom of the list you will note that we're not planning to bring for approval this year, but they are significant areas that we'll be working on, so I've added those for information. The Microsoft one, again, depends very much on you know, the agreement that we're seeking at that point in time. So there's quite a bit of work to be done before we get there. Things like the extent of a cloud, if indeed we're using the Microsoft Azure cloud services, and the range of services. And again, probably should have said all of these contracts generally are for services that we contract on behalf of the wider NHS. So again, the benefit of the services that we're contracting for is across the health boards and trusts and other stakeholders in Wales, as well as for the benefit of this organisation. So I don't know, should I pause at that point, Bob, if there are any questions in terms of the schedule at that point?
Yes, am I live? Yes, Michelle, we will just pause. I haven't got any questions in the chat bar at the moment, but we will just pause. I think that's very helpful. And can I just sort of clarify for my own understanding, where we've got the indicative values, that's the lifetime value of the contract, isn't it? So if it's a 5-year contract, that's yes, the cost of the yes, thing over 5 years. Yeah, I thought that was the case. I'm not seeing any other particular specific questions in relation to the schedule, Michelle. So I will take it that we are noting that as a board today. That's very helpful to see that coming through. And as you say, there are some big decisions in the sense of the contract values there, but also the importance of those particular procurements in terms of critical systems moving forward. So can you take us through then to the specific item today that needs board approval in relation to the specific procurement, the contract award in Appendix B?
Thank you, Chair. Yes, so I'll draw your attention to paper 4.22, which is Appendix B to the Procurement Report. So this is was the first on the schedule in terms of the contracts that I am presenting today for the approval of this board to enter into a contractual agreement. So obviously you've got the details in the paper. Just in quick summary, the contract that we're proposing to award is to Government Digital Services, or GDS as they are affectionately known. They're actually part of the Cabinet Office, so they're a public sector organisation that provides services across the UK. They developed this messaging platform in 2015, in fact, known as UK Gov Notify, and its purpose really is to issue communications across for a variety of purposes. It was particularly stepped up in support of COVID, so they made some enhancements to the platform, and it's being used by a number of public sector bodies. It's been endorsed for use by both the Welsh Government and the Westminster Government in relation to our response to the COVID pandemic. So we have had a lower value agreement in place with GDS to use this service since December 2020. We used it initially to issue letters to citizens in relation to the vaccination programme. So this is the you may have received them, an invitation in the post to an appointment to come and arrange your vaccination. So it's been absolutely key in terms of the way that we've organised the approach, certainly to the vaccination programme, and increasingly now we're making the move to other means of communication. So it also supports obviously SMS text messaging and emails. So what I should say, I think our expenditure to date, and certainly is in the region of 60 to 70,000 pounds to date on this service, this key service. We've put a contract value on there, again, a maximum contract value of 5.7 million. And that really is, we've tried to project in terms of the potential uses of the platform. Again, it is a little bit COVID dependent and dependent on things like the development of the vaccination programme and other aspects. So we've gone with what we think would give us sufficient coverage in the next 12-month period. And again, depending on what happens with the pandemic, we're not committed to that level of expenditure. It is a kind of a pay-as-you-go agreement, if you like, in terms of the level of the service that we use. And I should probably also reiterate again, the service, it's being used by the health boards and the trusts, and we are contracting on their behalf, or providing this facility on their behalf in order to enable them to engage with citizens and ensure that we can get those communications in place. So I'm seeking the approval of the board to execute that contract, and that contract will run for the next 12 months.
Thank you, Michelle. It is, as you say, a maximum value that's sort of set in there. But again, a procurement and contract for something which is absolutely critical in terms of the current response and the flexibility that the system needs to be able to adapt moving forward. I haven't got any specific questions in my chat bar, I don't think, coming through from board members. I will just pause for a moment just to see if anybody does want to pick up anything, but hopefully the paper is straightforward and the ask is straightforward in this. I think Ruth wants to ask a question. Ruth, can I bring you in?
Yes, thank you, Bob, and thank you, Michelle, for the paper and the presentation. That was very clear. I suppose my question is, I'm happy that we approve this in terms of being it's a pragmatic response, and we're doing this, during the pandemic. So I suppose my question is, if we weren't engaging in this contract because we need to, would we be doing something different? Would we be looking at a different supplier to deliver messaging systems? So I suppose my question is, in normal circumstances, what would we be doing differently to look at this?
Good question. Thank you, Ruth. And you're absolutely right. We have had to, in response to the COVID pandemic, we have had to make some quick and pragmatic decisions to ensure that we can move forward in the way that we wanted to. That said, we would have an underpinning market assessment, and we would have looked at value for money considerations and other considerations before entering into this agreement. So I think the fact that it was particularly endorsed for use, as I said, by Welsh Government and Westminster, it was the platform of choice, if you like, in terms of the response to the pandemic. So it certainly led us in that direction. And then I think looking at value for money and other considerations before we entered into that agreement, and we had to move pretty quickly, but we would nevertheless, I would still expect us to be doing those things, had led us to that decision. I mean, I think, to be honest, in terms of the wider engagement agenda with citizens, and certainly something that is in active consideration, we'd rather not be sending letters. So I think, anything that, moves us in more of a digital direction. And as part of the service we mentioned earlier, the digital services, patients and the public, that is about creating a platform so that we could engage digitally with citizens, accepting that that doesn't work for everyone, and we need to be very much aware of that. But I think that's certainly the direction of travel, and I would hope that we wouldn't be creating new services to generate letters. And certainly, Health Board and Trust colleagues would have been working on alternative means anyway to do that. Yes, in terms of, we do have a number of agreements around things like SMS messaging. So we use it for GP services, have used those kind of services for some time now in terms of appointment reminders. So, if this is a strategic requirement, if you like, an ongoing requirement in terms of messaging to citizens or to a wide audience, I think going forward we would look at the most appropriate way to do that, and then in 12 months time or earlier than 12 months we may want to reconsider what's the most efficient provider for those services.
Thank you.
Thank you. Yeah, thank you. Thanks for the question, Ruth. It's a really important question, actually, in terms of, we have to constantly remind ourselves that there are decisions that need to be made, and they have to be made in the right way, and they have to be open and transparent, that are contextual to the circumstances we find ourselves in at the moment. But that doesn't mean that, long term, we don't look at the alternatives to this. If there is an identified need for these kind of services, we will, of course, do that. And I think, as Michelle has pointed out in the paper, this agreement is for a 12-month instance in the first place. There's an option for a second year, Michelle. I think that's right, but it's not a forever commitment, if I can put it that way. Okay, I've got a couple of other questions come in. I think Rowan, you were next, and then Sian. So Rowan.
Thank you, Chair. Michelle, absolutely support this initiative. Living as I do on the other side of the border, outside of God's promised land, if you like, I myself have received this messaging, and it's very powerful, very effective, and gives the health providers flexibility as well to re-engage with patients. And of course, this is at the heart of the need for confidentiality around patient information. So it's not just the baseline capability, it's also, it needs to be within the envelope of confidentiality. I would just reflect, Michelle, that there's value for money considerations, and I suppose I would say value for mission statements. And I think you touched on it with the need that this increases, if you like, our digital muscles in terms of providing capability to the Welsh NHS to engage with patients. I would encourage us to try and measure, going back to the patient engagement, our Welsh citizens' response to this type of facility, so that that will feed into future procurement, and would encourage you to do that. I think you've mostly answered that, so I won't necessarily expect a response. I just wanted to record that for the benefit of the record. Thank you.
Thank you, Rowan. Michelle doesn't need a response if you don't need to come back. I think it's a very helpful point that that Rowan is making there. We've got one other question from Grace, and then I will move us on. So Grace, can you ask your question?
Thank you, Chair. I appreciate the need for this and the effectiveness, as well as the powerfulness of this messaging system. I'm just wondering, going forward, if it's useful or possible for us to look at best practice for public health and COVID messaging and similar worldwide. For example, I know there's been quite an influential report on Taiwan's public health messaging 10 years after SARS and how they responded and really upgraded their public health messaging in relation to SARS. And the report is suggesting that it actually had a huge impact on Taiwan's approach to COVID and you know the very, very low rates they've had. So I'm wondering if that's something that we can look at going forward. Thank you.
Michelle?
Yes, I mean, I think you're absolutely right, Grace. I'm sure there are lots of lessons that we will take for this, and also as the chair just mentioned, we had to move incredibly quickly, I think, to stand up some of these services. So, and I think you know, with reflecting in Wales that we've been very successful in terms of the vaccination campaign and the you know, the number of individuals we've been able to vaccinate. So I think yes, I would agree. You know, we've been able to step up. We've been able to move quickly. Inevitably, with the beauty of hindsight, or indeed, we, you know, planning ahead. And I think that's the key lesson now, isn't it? What can we learn, and how can we make sure that we've got foundations in place as we move forward that would enable us perhaps to respond in different ways. And I think your point about the you know, the wider point about the public health messaging and how, again, I think it goes to the agenda of empowering individuals to manage their own health and well-being, doesn't it? And how we can really do that in a more effective way. We've obviously worked very closely with Public Health Wales colleagues throughout the pandemic, and we provide data and support to them. And I think it's something that conversation will carry on, won't it, in terms of things like our digital platform for patients and citizens, how we can really reflect on the last year and reflect on how we would like to you know, work with and support citizens as we move forward. So yeah, absolutely, really good point. Thank you, Grace.
Thank you. Thank you, Michelle, and Grace, thank you again for your question. I know Helen wants to just come in, I think, with a comment on this as well, and then I'll move us to decision. So, Helen.
Thank you, Bob, and Grace. Yes, I suppose in response, and Michelle has covered some of that, that the current letters that go out contain quite a lot of public health advice in relation to the current kind of pandemic and the risks associated, and all of the advice that we're now all familiar with. And as Michelle says, we would work with Public Health Wales as our statutory body to kind of provide that information out there to the public on the sorts of mechanisms we would use and the sorts of messaging. And it's probably worth pointing out actually the links across to the digital services for patients and the public moving forward, and the SRO of that programme is actually the Deputy Chief Executive of Public Health Wales, so lots of opportunities to make sure that we're tightly aligned really in terms of our support of that public health endeavour. Thank you.
Great. Grace, did you want to come back, Grace?
Yes, if I can, thank you.
Yes, just wait to go live, I think. Okay.
Thank you. Yes, just absolutely agreeing and noting that, as you say, Michelle, I think Wales has both a lot to teach in, you know, what we have done and how we have done this, and also being a learning organisation and being always looking for development, we also still have a lot to learn, and looking at ourselves both within the UK and our position more globally in that learning and teaching role as we contribute to the global fight against COVID and for wellbeing.
Okay, great. Thank you for those very helpful questions, and again, Michelle, for taking us through both the schedule of procurements and the discussion around the contract award. On the basis that no one has said anything to me separately that they disagree with what we're being asked to do as a board today, I'm going to now move that we've approved the contract award as set out in the papers. So thank you for that. I said we would take a comfort break. We're a little bit behind our schedule, about quarter of an hour, so I will try and get time back in the second half of the meeting. But I think it's important that we just take a comfort break. And so if I could suggest that we come back at midday, please, so around about 14-15 minutes time, and I'll see you all again in a few minutes. Thank you. Well, welcome back, everybody. We can move on now to the rest of our agenda, and to complete section 4 on the agenda of our strategic items for today. I want to invite Chris Darling, our board secretary, to present the report on our proposed approach to shared listening and learning in DHCW board meetings in the future. So Chris, can I hand over to you to present the paper, please? Chris, you're on mute.
Apologies, Chair. This paper picks up from the discussions we've had earlier on in the agenda in terms of our role working with the public and citizens and their input to the organisation. So the report set out as item 4.3 proposes that the future DHCW board meetings start with a patient, staff or health and care professional story as part of our shared listening and learning approach. And the purpose of doing so is to remind and reinforce to board members the core purpose of DHCW in taking forward the digital transformation agenda needed for better health in care in Wales and making services as sustainable and accessible as possible. DHCW works collaboratively with health and care organisations, professionals, patients and members of the public. And patient and health and care professional stories can allow for lessons to be learned, bringing to life real life experiences and ensuring that the value of digital and health and care is considered in different scenarios and experiences. So the approach proposed within the paper is considered good practice from other NHS bodies across the UK, building quality, safety and learning through experiences into the boardroom. And in addition, becoming a learning organisation is one of Welsh Government's citizen-centred governance principles and is highlighted in the Good Governance Guide for NHS Wales boards. In terms of practical guidance to the proposed approach, we've taken advice from the Leadership for Safety How-To Guide supplement using patient stories within boards. So stories would be considered in a number of ways, working with our partner organisations. And I think, as Helen mentioned earlier, working with the Digital Services for Patients and Public programme, which has as part of its governance arrangements a patient and public assurance group. So there are various methods by which stories can be presented to the board, and it's proposed that any stories that did come forward in the future, if the proposal's supported, would be monitored in terms of discussion points, tracking actions as a result of discussions and any learning to come from them. So the paper really is setting out our proposed approach for future board meetings and moving us forward in the space of becoming a learning organisation. So I'll pause there, Chair, but happy to take questions or comments.
Thank you, Chris. I certainly say I would add that I really welcome this paper coming through in terms of finding mechanisms to make sure that we are connected and have a deeper understanding of the wider system, and that recognition that, you know, it's easy to look at us as a sort of a technical organisation, but we are a patient-facing organisation as much as every other part of the health service is. Marion, I think Marion wants to come in with a question or a comment.
Diolch Cadeirydd, and thank you, Chris, for your presentation. I really welcome this approach, and I have to say I've seen it in a previous organisation how the sharing of patient stories can be hugely insightful into the workings of the NHS. And of course, as reflected in the paper, we don't directly provide patient care, but we do underpin all that the NHS delivers in one way or another. Absolutely. So particularly welcome this approach. My question, I guess, is in terms of a learning organisation, it would be helpful for the board to understand what exactly the process will be for sharing any learning that arises from these patient stories. Thank you.
Thank you, Marion. Yeah, and I think as set out, a framework will be developed to take this forward. as part of that, I think tracking learning that gets discussed within board meetings and actions that we will take forward as a result of that learning to come back to future board meetings, I think is really important in this agenda being taken forward. So there's complete transparency around what we've heard, what we've listened to, and some of the actions that we feel we can take forward directly ourselves, but also actions for us to collaborate with partners, citizens, to take forward some of the learning.
Diolch, Chris.
Thank you, Marion, and thank you, Chris. I'm not seeing any other questions coming through from board colleagues at the moment on this. As you say, Chris, this is a paper about what we do in the future. So there's no specific decision on that today, other than I think approving the approach, the proposed approach that you've set out in the paper. So we'll take it that has been approved by the board, and we'll look forward to incorporating this approach into future board discussions. So thank you for that. I'm going to move us on now into the next part of our agenda, which is around governance, risk, performance and assurance, and it's back to Michelle again. A busy morning for Michelle in terms of big papers today, but Michelle, as our Chief Operating Officer, is going to take us through the performance report, and I think as we spoke earlier, it's to recognise the opportunity to discuss or comment on any specific issues that are coming out of the performance report, but also in a sense on the report itself. As a new organisation, this is embryonic for us in terms of how we develop an effective performance reporting system for the board and for those other people outside of the organisation who need to know what we're doing and how well we're doing things. So I would also invite thoughts and observations, comments on the style of the report and the approach that we take to this, as well as the actual sort of content of the report today. So Michelle, I'll hand over to you if you can take us through the report, and then hopefully we'll have some time for questions and comments at the end of that.
Thank you, Chair. And as Bob has just pointed out for us, this is a new report along with our new board, and I'm really keen to take on board feedback and to get the pitch right, really, in terms of the level of assurance that we need at this level. We do review the report in some detail, as you would expect, at various forums inside the organisation, including our management board. So a week ago we would have gone through quite a lot of the specifics around performance. So this is about getting the pitch right for the board, and I would greatly appreciate any feedback or questions. So I was just really going to perhaps walk through the way in which we've approached the structure of the report and pull out some key points that I wanted to bring to the attention of the board today. In the cover paper, so this is paper 5.1, I think in your papers, if you wanted to pull it up, we've set out a bit of a summary. It's quite a long summary, to be honest, so we may want to look at that in terms of the key aspects, and a number of the points you will note were covered in the Chief Exec's or Chair's updates at the front of the meeting. So I'm not proposing to replicate that detail, and we can look at how we do that going forward. The summary was included really to try and be helpful, so let's make sure that it is. So really the report has two main aspects to it, I think. So we've got specific section on performance against the plan. So you will hopefully recognise the plan on a page that I mentioned when I was going through the plan earlier, and our suggestion that was how we would demonstrate performance against the plan at the board level. So you will see that, and I will highlight that as I go through. And then we've got all the other aspects, she says, as I group those together in terms of how the way in which we operate as an organisation. And again, you will note on the agenda in some of those areas, so in finance, for example, our Director of Finance will be taking us through a specific report on the agenda today at a greater level of detail than we've included here. And likewise, we'll be considering a separate report on risk. So again, I wasn't planning particularly to drill into the detail of those. I was just going to start perhaps by reflecting on what we've called the scorecard. So we have tried to summarise the majority of the aspects of the report on page 3, if you've got the report in front of you. And the scorecard is intended really. It's a bit of a quick reference, isn't it, really, to the various aspects, and you can drill into the detail of all of those aspects in the report. but it gives us a quick view on and perhaps areas that where further focus or attention is required, and that's certainly the way we look at it from our management team perspective. So just by way of summary then, in terms of those key aspects, you will note, and I'll just run through a little bit of rationale perhaps as to why some of those things are presented in the way that they are. So the first thing to note in terms of appraisals, so these are the regular meetings that we would expect managers to be having with the people in their teams to make sure that we've got a clear view on how, you know, what's expected of individuals, whether they're performing in the way that we would expect, but it's also an opportunity, I think, to have a bit of a discussion, make sure we're supporting people appropriately, and particularly key perhaps in the current scenario where the majority of our folks are working remotely, keeping in touch and making sure that we are all you know, comfortable and confident in the way that we're undertaking our roles is really important. Now, you'll note on the report, unfortunately, following the transition to Digital Health and Care Wales, we have had some challenges with our electronic staff record system. It's actually a third-party system, I should slightly cheekily say. It's not one of ours, but it is, nevertheless, it's a really key system that's used across Wales, and we are working with the supplier to rectify these issues. A few teething troubles following the transition, so unfortunately I've not been able to report on our appraisal position, but I would expect to do so the next time we meet as a board. Statutory mandatory training also, we have had some challenges following the transition with that. We are showing a compliance figure which is slightly below the target, so that is an area of focus. The majority of our teams are actually above target, so we know we've got a couple of specific areas that we need to focus on. So we've got about 17, I think it is now on the list, statutory mandatory training requirements, which are clearly really important to ensure that individuals are appropriately informed and geared up to undertake their roles. So we will be focusing on those as we move forward and ensuring that we can get that up to the level that we would expect. Just a comment there on audit actions. So we've highlighted there was when we did the April report one action that was not completed within timescales. I understand that one has now been closed. So we have taken the action necessarily to address that audit recommendation, and the action plan in relation to that was agreed at the management board last week. So that one I'm confident is in a good place. We've also got we've invested a lot as an organisation again in quality and also external accreditation. So our ISO and BSI standards are really important to us as measures in terms of how we deliver and how we meet the quality agenda. So we have identified that some non-conformances there. These have come out of fairly recent audits and not entirely unexpected. So you would expect when you have an audit that some things will come up. Clearly they need to be addressed. And I'm pleased to say that we have retained all of our accreditations through that process. So work to be done, but not at risk of losing those accreditations, so not at that level. And the final point from a commercial services perspective, again, I just wanted to share with the board reassurance, if you like. We have a really good commercial services team within the organisation that supports some of our activities. You will have enjoyed the procurement report. That would be one of theirs. But what we have found with the team is increasingly, particularly with COVID and other priorities, we've had to divert or prioritise our procurement activities, which has meant that we haven't had enough strength and depth, I think, on our contract management activities as part of that team. That is not to say that we don't manage our contracts, but I would certainly like us to be doing more in that area, and really important in terms of how we ensure we're getting maximum benefit from our commercial relationships, as well as kind of the standard contractual compliance. So I am pleased to say we've had some additional funding through the setup of Digital Health and Care Wales, and we are growing that team. In fact, appointments have been made into that team, and I would expect to be including in the report going forward specific contract management metrics if the board feels that would be helpful to them in terms of understanding overall performance. So I wasn't necessarily going to go through all the various things you may be pleased to hear in the summary report. I did want to draw your attention to a couple of points in the performance report itself, and then perhaps we could focus on feedback and questions as the chair suggested. So I've talked about the scorecard on page 3. If I could direct your attention to page 10 of the performance report. So hopefully you will recognise that is our plan on a page. And what you can see there is that we are proposing to use a RAG rating against the plan, and that is indicating the performance as of April. So this is our April performance report. So that's obviously the first month in the first quarter, so I'm quite relieved that it's all looking green. But that's the level of expectation we set as we go forward. But this is the April position, so it's an actual as opposed to a forward-looking position, if that makes sense. We've decided to report on actuals. So currently, in April, in Q1, we are on track with where we expected to be with all of those key deliverables that we've identified in the plan. There's also some additional commentary in the document itself about achievements in the period and starting to move towards, we've called it impact, so starting to try and be a little bit clearer about the impact of the deliverables that we've achieved, but obviously, as we've recognised a bit earlier, I think there's definitely more ground to cover there, so we need to get into that in terms of benefits. So I was just going to move on. I wanted to draw your attention to page 17 as well. So we're reporting on the usual, I guess, kind of workforce measures. So we look at sickness, and our sickness rates are low, I'm pleased to say. Certainly in comparison across the NHS, although obviously we're not delivering frontline care, so we are slightly different. But also we've been keeping a close eye on COVID, as you might expect, in terms of a potential impact to our workforce and our ability to sustain services. So I'm equally pleased to say no COVID cases in the organisation currently reported. But page 17 I'm highlighting because I have certainly mentioned a couple of times this morning, and you will see coming through the position of the organisation, that recruitment and our ability to bring in new people and new skills and develop skills is going to be absolutely key for us as a board as we move forward through this year. So we've included in the performance report a bit of a tracker, really, in terms of where we are against plan, and hopefully the board find this helpful, or again, pleased to take feedback in terms of how we are progressing with that work particularly. So if you look at the slightly intriguing diagram on the right, it only starts in March. That's when we stood up our recruitment task force and indeed had confirmation of our funding position to enable us to move forward with some of these new appointments. We're actually running just below target. So if you take the yellow line is the target, it's a whole-time equivalent target. So unfortunately, the light blue line is the actual, is where we are in actual people sitting on seats, I like to think. So we were running at the end of April, I think 808 whole-time equivalents against a target of 821. So again, work to be done here, and we've stood up a specific task force inside the organisation representing various teams and led by our head of workforce to really focus on that. And we've taken actions to really focus that as an area of priority for us as we move forward. And you can see some of those actions that we've taken in the report. So the final point I just wanted to point out, if I can point you to pages 21 and 22, perhaps. And I say carefully, our Director of ICT is with us today, so if you've got any difficult questions, I may well pass them to Carwyn. But I think it's important to recognise my point earlier today of the circa 100 services that we already operate across NHS Wales, as well as the new things that we are keen to develop and deploy. So what we're showing here on page 22 is a sort of a performance snapshot, really. In terms of our management of those services, and it is quite encouraging that the majority of the sheet is green. I think that's quite nice to see in a performance report, although you will note in April and amber. So what this is showing, and there's a bit of a key in the bottom left of this page, is that we have service levels, as you might expect, in place in relation to our services. Those may be classified as critical or standard services, and that obviously impacts the response and the hours of cover for those services. And we set service levels, and those service levels have been agreed with the wide stakeholder group as the levels that we will seek to achieve. And you will note in April, in terms of incidents resolved, that has fallen below the target service level. And there is some explanation in the pages that follow. That was, we were dealing with particularly 3 significant issues in relation to our firewalls. Those resources were diverted, and those were dealt with within the required timescales, but that did unfortunately impact on other incidents during that period. So that's something I'm sure that Carwyn will be looking at with the team and looking at how we address that going forward. The other point you'll note, just for clarity on that particular chart, the GP services at the bottom of the chart. So we engage 2 commercial third parties currently to deliver our GP systems. I mentioned that we were reprocuring at the moment. So Vision and EMIS, who deliver those services, and the reason that they're not in the table is that there is a bit of a time lag from us receiving the reports and validating those reports with the third parties. So you will see the April numbers in the next report that we present to you. So again, we are expediting that as far as we can, but we do need to go through a validation process with the third parties to ensure that we're reporting the correct data, and we're keen to do that, and that's why they're not appearing in this version. So those were the sort of key points that I was going to raise. As I said, there's a lot more detail in the report. Happy to go through any of the detail or to take any questions as colleagues see fit. Thank you, Chair.
Thank you, Michelle, for taking us through the report. As you say, there's an awful lot in there, and it's very comprehensive. I like the fact that it gives us that holistic overview of the organisation. I think there's a risk sometimes with certainly some of my experiences in health boards where the focus tends to be on money and sort of operational activity. But I think the balance report that we've got here gives us a much broader sense of what is going on across the organisation. I think you said in your opening remarks, Michelle, the risk we run, I suppose, is duplicating where we go through other elements of the agenda. So, for example, we've got the finance report immediately following on from this one. So I think that's something that we need to have a sort of offline, have a discussion around in terms of just making sure that we are organising and ordering our sort of board agendas, so we don't duplicate and overwhelm board directors with too much paper around some of these things, because we're giving them twice, I suppose, in some ways. I can see a question from David. David.
Thanks, Chair, and thanks, Michelle, for the presentation. Particularly like the scorecard. That's very helpful from a independent member perspective. I've got a clarification question. Does the operational service delivery metrics include our in-flight development programs? And I'm thinking of performance against milestones, or is it just the things that have gone operational that are now digital services?
Thank you, David. Yes, the last chart that we were looking at when I was talking about is the services that are live, so live and in use by our stakeholders, as opposed to the products in development. Does that make sense? So some of the live services, we will obviously be, we will be having new releases of software, but those would be included. But the new products start to be included in that count as and when they go live as services. Does that make sense?
Yes, it does. Thanks. I think in which case it would suggest, as part of the development of the performance report, we may want to include that, because I suspect there's quite a lot of our activity is focused on in-flight development programs, and it would be good to have some visibility of those from an assurance perspective. Thank you, Chair.
Thank you. Thank you, David. Rowan.
Thank you, and thank you, Michelle, for summarising an extensive report. So very grateful for that. I think I would comment that this is as you reflected, part of a journey and learning how to work together. I really like the ambition of the plan on a page. I think it also merits, though, observing some of the challenges around it as it's currently conceived. And I will illustrate that by just on the go live with the nursing care record. So you spoke earlier about how other organisations benefit from what we do, and going live with something is reaching the starting line of the programme, and actually the benefits and how we deliver value to our partners are the race that we run together to deploy it. And so you can see right there that we've got something that's green. Yes, we've got to the start line, but if that content doesn't change, there's no visibility to the board in how we get assurance that we are working effectively with partners. So I think this is part of a much bigger discussion, and I hope, Bob, I would ask the board to schedule some time in our next development session, because this is a co-creation exercise to get this right. And perhaps, Bob, you could just note the need for that going forward.
Yeah. Bring me live. Yeah, absolutely, Rowan. I mean, that is the intention, and I think your words co-creation is absolutely right. This has got to work for us in a number of different ways, hasn't it? It's got to work so that as a board, the board can gain assurance in terms of things that are happening in the organisation, that within the organisation, senior leaders and managers know what's going on in the areas that they're responsible for, but also in terms of our external relationships as well, so that we are being transparent and open with people about what is happening. So I do think this is a really important piece of work. It will probably be forever evolving, I suspect, in terms of the way that we do this as the organisation moves forward. But yeah, so thank you for that comment and the assurance, Rowan, that we will indeed do as you ask. I can see Marion wants to come in for a question, and if I'm fidgeting around, I'm trying to get some light back on my face. I seem to be permanently in shade as I'm talking to you, so my apologies for that. So ignore me for a second.
Diolch, Cadeirydd. Thank you, Chair. Yes, and thank you, Michelle, for presenting this. I won't repeat the comments made by both Bob and Rowan, but it is a journey, isn't it? And it's going to be continuously evolving, and DHCW is no exception. It's what happens in other health organisations as well. Perhaps by way of sort of highlighting one aspect, I mean, I welcome the clarity of it. In terms of one of the key issues that was highlighted during the public council, that was the workforce issue, and I really welcome the tracker that you provided, which gives us an indication of the journey of travel on this particular aspect. I think it's one example of an important area which would merit a deep dive at some point, whether we do that at board itself, focusing on one specific area. I think that would be helpful, especially in the first year of the development of this board. And for me, whilst recruitment is important, and you've highlighted that very clearly, retention as well, it would be good to get some clarity around staff retention. I'm looking specifically at the operational performance and the service desk performance, which is mixed over the course of the whole of last year, and clearly it seems to have been largely addressed by April of this year in terms of the recruitment of new staff. But I guess it will be sort of interesting and important to see how effectively we retain staff in order to maintain better standards of service desk performance, as one example. So those were just my initial thoughts on today's report, but thank you. Diolch.
Thank you, Marion. I don't know, Michelle, if you want to come back on any of the points that Marion's raised. Yes.
Yes, thank you, Marion. I think from a workforce perspective, I would absolutely agree with you. We could spend an awful lot of time trying to attract people to work in an organisation, and if this isn't the organisation that they want to work in, then you know, it's wasted time and energy, isn't it? And I'm really proud of the things that we did as NWIS, and that I expect us to build on, and as DHCW, in terms of our investment in the people. I think I mentioned it earlier. We are clearly a people organisation, and everything relies on you know, the ability. And again, I probably said it before, I'm really proud of the way our people have responded in the last year and adapted to very different ways of working, and really stepped up. But it's an ongoing opportunity, isn't it? How we can, you know, things like our talent management or succession planning, making people feel wanted and valued and a key part of the NHS, and you know, encouraging their development. Workforce planning is something that we've got particular focus on, so we can bring people through our organisation, and hopefully you saw things like in the recruitment task force, we've had quite a lot of success with things like bringing graduates in, or bringing people into the lower levels of the organisation, if that's not too derogatory a phrase, but then working with them, developing them, you know, really encouraging people, and then you can see them progressing through the organisation, and that's really encouraging, isn't it? And it's something that we definitely want to focus on. So thank you, Marion, and I note your point about the deep dive, and happy to support that going forward. Thank you.
Perhaps I could also, just before I finish, add my congratulations to what's highlighted in the report, being DHCW being winners at the Go Wales, the COVID-19 awards, and really wish the team well as they enter the next round at the UK level. So well done everybody.
Thank you, Marion and Michelle. I think we've got one more question from Sian, and then I'll move us on to the next item on the agenda. Sian.
To unmute very quickly, apologies. Diolch yn fawr. Michelle, thank you for the report. I think it's a real foundation for us all to work on. I'd quite like to suggest that we work hard on the executive summary in terms of what we really want to worry about and where the risks are, or what we're mitigating. And that's not only the risk, but also celebrating, to Marion's point. I also think it'd be good in this report to reflect on what the milestones are for the next month, so that people understand what you really are trying to deliver, you know, sort of know the scale of the programs that you're working on, and then reflecting on that at the next board, because I think we then can become a little bit more understanding of some of the challenges you have. So, but it's a really good start, and as we've talked about, it'll evolve, I'm sure, over the next few months. So thank you.
Thank you. Thank you, Sian. I don't think there's any other questions on the report today. So again, thank you to Michelle and team for pulling that together and for going through it with us today. I think, as we said, you know, this will evolve, and we will work together to develop this, to get it right for all the various purposes that we need to look at our performance report for. If I can move us on then, and the next item on the agenda, 5.2, is the finance report. So I'm going to hand us over to Claire, who will take us through the present her finance report to the board today. Claire.
Thank you. Thank you, Chair. Yes, so this is the first report of the first month in our first new financial year in DHCW. The report in the first instance highlights and reminds us of the financial duties as a board that we have to comply with, and those about remaining within our resource limits for both capital and revenue. There's also a few other areas that we need to focus. One of those is in the public sector payment policy. This relates to the non-NHS creditors and ensures that we pay them promptly and in line with government requirement. The other one is in relation to cash. And as we are, and again, this is about working within the allocations we have. As we're currently closing the year end, and we will finally transfer our ledgers from Velindre into the new organisation and sign them over on the 30th of September, we are working in an interim arrangement in conjunction with Welsh Government in our cash allocations, as our cash requirements will then become a lot clearer, and then they will then restrict our cash allocations and our working requirements. So those are the rules within which we need to bear in mind and operate within. And then moving us on then, in relation to the month of April and our performance against our key targets, for noting, the performance in April resulted in a revenue surplus of just short of 300,000. That's really a reflection of the conversations we've just had in relation to some of the vacancies that are currently within the organisation and the work that's currently underway as part of the task force to really add pace against some of these key positions that we're recruiting to. So going forward, that will be a key aspect in terms of our ability to deliver plan and deliver on our balanced position. So so in month we were lower than required in terms of the revenue, but that was really reflecting the position in terms of the workforce aspects. In terms of our COVID and our digital priorities investments, progress against those is going well. And again, the funding allocations will very much be in line with the expenditure in the month as they are given as and when where they're used. So in line with both of those, then we are doing well against our plans. So in terms of revenue, the outlook currently, again, it's just the first month and we will do quite a detailed analysis after the first quarter to understand the position going forward. Will be very much below. We currently predict that we'll be balanced at the end of the year, and really work will be focused on the rate of recruitment and how that will impact our position. In relation to capital, again, there are many aspects to our capital programme, from our discretionary allocation through to the digital investment funds and also any investment in relation to COVID. In the month of April, our spend was slightly behind plan with 30k, but actually it has progressed well. And again, it details the analysis by the capital programme and for the month and the anticipated spend for the year. Again, we expect that we will spend in line with our capital allocation, and again through the year we'll be monitoring progress against that back and forth to the board. So at the current position, against our key deliverables in terms of finance, we are all in compliance. We've also built into our plan a 2% saving targets, and obviously we are delivering against those in the month. And then finally, just some highlights, some risks and opportunities. Again, in relation to substantiating our vaccine funding requirement, we're working with Welsh Government. We have submitted a full paper and that is imminent. And there are two other risks identified in the paper. They are minor in terms of financial, and they relate primarily to the finalisation of our SLAs with health boards. Those are due for completion in June, so they were emerging issues. And again, they subsequent to this paper, we suspect we'll be able to manage those through those SLA arrangements with the boards with minimum, if none, financial impact. There are, of course, opportunities. Again, we talked about pay efficiencies, which is the flip side for not filling your vacancies. But equally, we are seeing from the test, track and trace aspects of the COVID response that some of the volume of licenses that we initially thought is currently lower. And again, that money will just be credited back to Welsh Government as and when it's realised. So that was really the key highlights in the month. A couple of aspects that we're working on within finance is obviously we are doing work on our infrastructure and cloud transition programmes. As Michelle alluded to with the commercial key contracts, strategic contracts previously, one of those is obviously Microsoft, and in the forthcoming month and quarter we will be finalising that contract arrangement for next year. Again, working alongside health boards to ensure that we do that in the most efficient and effective manner. And finally, we are working alongside our colleagues in Velindre to ensure that the previous year-end close and audit requirements is completed, and then the final transfer of our balance sheets will be done in a most efficient and effective manner. So that's for the board to take note and to discuss or ask any questions. Thank you, Bob.
Thank you, Claire, for taking us through that. Very clear, I think, in terms of where we're at in terms of current position and end of year forecast. And as you said, there's sort of performance issues around a number of other areas like sort of capital and public sector payments policy and so on. I know Sean wants to come in with a question.
Yes, quick question, Claire. There's quite a big variance between the actuals and the budget, bearing in mind we're in month 1. Is that something you're anticipating that's going to carry on, or will the forecast start sort of extra? Is it a timing or phasing or whatever? But it's just quite a big discrepancy, right?
Yeah, so we're in month 1. So after the first quarter, I'd probably be able to give you a better indication as the longer term consequences of that. But actually, the driver of that is really the vacancy factor that we've been discussing, and really the recovery of that will really much reflect the success or otherwise of that workforce tracker group. And having said that, it's the first month we've operated as an organisation, so our non-pay was unusually low and variable. So I think as the quarter progresses, we should have a clearer picture of what that looks like. So I will report back to the board on the progress against that plan. And Welsh Government have a touch point with us in June, and they will test that as well. So we will be ready for their response in that area also.
So if the saving is a lot in recruitment, that will be a saving that you'll carry through, because you're never going to recover that, right? From a
well, we could look, yeah. So you're right, but we are looking to look at alternatives to recruitment and bringing in external parties to support some of our key workforce gaps. So what we might see is that non-pay switch, which will offset it. But again, we're working on both of those scenarios. And again, once that becomes a lot clearer, then we'll be able to report progress back to the board.
Thank you.
Great, thank you, Sean, and thank you, Claire. I'm not seeing any other questions from board colleagues in relation to the finance report. I think the report is very clear and self-explanatory. So for the record today, we're noting the report, Claire, and the forecast of sort of year-end achievement of key financial targets at this stage, and we look forward to the next report at our next formal meeting. So thank you for that. That takes us on to item 5.3, which is around the risk management and board assurance framework strategy. And for this one, I'm going to hand over to our board secretary, Chris Darling, who's going to talk us through this.
Thank you, Chair. So within the board pack today, there's 3 papers: 5.3, the cover report, 5.3i, which is the strategy itself, and 5.3ii, which are the milestones. So I'm going to work through the headlines from the cover report and then talk through the key milestones. So Digital Health and Care Wales has inherited the MWIS approach to risk management, specifically in relation to the risk management policy, which was adopted and approved on the 1st of April. This risk management and board assurance framework strategy, set out as 5.3i, has been developed to build on the existing arrangements for the oversight of risk management, but taking into account the role of the DHCW board within that, and expanding the approach from risk to risk and board assurance. So the purpose of the strategy is to provide guidance to all staff on the management of strategic and organisational risks and board assurance within the organisation. So the risk management strategy covers the management of principal risks, so those with the potential to impact on the organisation's strategic objectives, as well as organisational risks affecting individual departments, services and directorates. And it works through the process for escalation of risk for inclusion on the corporate risk register, and also the work to be undertaking to develop a board assurance framework report that will come to future board meetings. So in terms of the board's responsibility, it sets out that executive and independent members of the board share responsibility for effective risk management. It also talks about the role of the Audit and Assurance Committee, to review the establishment and maintenance of an effective risk management and internal control system. So as a new statutory body, the strategy does propose that the DHCW committees have a role to play in overseeing and scrutinising risks on the corporate risk register relating to the committee's areas of responsibility. Another proposal set out within the strategy is that we adopt a consistent approach to how we articulate and describe risk, so using a if, then, resulting in approach. And the risk management reporting structure and thresholds for escalation within the strategy are also set out, noting that as the board develops and articulates its risk appetite, they may need to be re-looked at, but they're set out as they are at the moment. As I said, item 5.3II sets out the key milestones and dates, that some of which will be firmed up over the coming weeks and months around our journey around risk and implementing this strategy, including the articulation and agreement of the DHCW board risk appetite and tolerance, so the amount of risk that the organisation is prepared to take in pursuit of our strategic objectives. So before I move to the milestone plan, I think it's just worth noting that as a board, we're on a journey to develop and agree principal risks and articulate our risk appetite as set out within the strategy. So I'm just going to work through item 5.3II and some of the key elements of the milestones. So milestones 1, 2 and 3 all relate to the approval or agreement of the risk and board assurance framework strategy, and then implementing some core elements such as risk articulation and understanding the strategy in detail using the organisation's risk management group, which has representation from each of the directorates and service areas within DHCW. And a key part of that will be considering how our risks and potential impact on the wider health and care system are best communicated and articulated to partners, building on the arrangements in place through service management boards and project boards. Section or milestones 4 through to 7 talk about the journey that we need to go on, and a lot of this will be through facilitated session as a board, through board development around identifying and agreeing our principal risks. Now that we've approved our annual plan today, we've got our strategic objectives, so working back from that and understanding the risks to delivery against those objectives, and doing some assurance and controls mapping against those to understand where there might be gaps and some of the actions that are required to address those gaps. Point 8 of the milestones talks about the need for some risk management training to embed what's set out within the strategy. And then milestones 9 and 10 talk about the work we need to do to develop, consider, understand board members' approach to risk, and ultimately agree and articulate our risk appetite as a board, something that can then be communicated to the organisation more widely, shaping our culture and approach to risk as an organisation. And that will take a number of months, as I say, to work through, but it's scheduled in and dates are being firmed up. And the last 3 areas really relate to once the articulation of our risk appetite has been approved by the board, going through the process to some extent in the future as we develop our plans for next year. So I'll pause there, Chair, and happy to take any questions or comments.
Thank you, Chris. I've got one comment I want to make, but I think Ruth wants to come in, so I'll go to Ruth first if I can, in terms of a question or a comment.
Thank you, Chair, and thank you, Chris, for pulling that together. I think the key thing for me, as Chris you've outlined, is the setting of our risk appetite and discussing what our risk appetite is as a board. And part of the reason that needs to be so clearly articulated, it comes down to your point, it's number 8 on the milestone plan around the risk management training for DHCW staff. To a certain extent, it doesn't really matter what framework we're using for scoring our risks. What matters is the culture that we're setting as a board, and that our staff understand what that culture is and how they are able to operate within that when it comes to assessing and managing the risks that they see every day. So for me, that piece around staff training is less about, and I think we just need to be very, very careful not to fall down the track of giving everybody some e-learning to do, or saying go off and do this and this is how you score a risk. It's less about actually the mechanics of it, and it's more about the cultural environment that we're setting as a board, and being very clear about that. So I don't want us to get lost in process when it comes to this. We have a clear framework and we can agree that framework as a board, but I don't want us to get hung up on the, and if we score this, does it go there? If we do that, does it go there? What this needs to enable us to do is to express as a collective our attitude to risk, and for the organisation to understand what that is, and that we can explain that to our stakeholders externally. Thank you.
Yeah, I mean, just to come back on that, I concur with everything Ruth has said, and I think the cultural piece and the journey that we need to go on is vitally important, and communicating that widely across the organisation. So I agree completely.
Thank you. Thanks, Chris. Thank you, Ruth. That's a really important point, and you know, certainly we'll take that on board fully. Helen wants to come in, and I think then Marion.
Thank you, Bob. Yeah, just to say I really welcome actually the framework that Chris has brought to us, and the approach that it outlines. Yeah, really excited about it actually, and I mean probably quite sad to say that, getting excited about risk management, but actually I think this is absolutely key and a critical activity for us as an organisation. I completely endorse Ruth's point around kind of, we need tight process, we need to be clear about process, and the framework will help us to actually really be, you know, to manage that. But actually this is about culture, and this is about us actually being transparent about risks, and actually being clear about how we're managing a mitigated risk really, and how we're taking that forward. So yeah, really welcome it. I suppose my final point is in relation to risk appetite and the work that we need to do, and how we differentiate the risk appetite of the organisation, and how that distills down to the services that we have. And we may have kind of, you know, differential risk appetites through our services, and we need to make sure that we design it in that way that kind of is clear really, and that makes sense and is transparent to the board and to our wider stakeholders and the public.
Okay. Thank you, Helen. That's helpful. Marion.
Thank you. It's just a brief observation from me really that we did consider the Board and Assurance Framework Strategy at our first audit committee meeting on the 11th of May, and I think it's just important to add that we had a good discussion and very much welcome the approach being proposed here. It's a very clear framework and I think it provides a very good foundation for the work that Chris has outlined going forward. So we were quite unanimous in endorsing this for onward consideration for the board today. So I just thought I'd note that for transparency. Thank you.
No, thank you, Marion. That's helpful actually to understand that, and in the sense it's part of our wider process, which is clearly not visible today. That there's been that sort of detailed discussion by other board members and officers around this before this actually coming through to the board. Chris, I had one sort of thought and observation I just wanted to share as well, which was when I was kind of rereading the paper, I was thinking about, we frame this very much as Digital Health and Care Wales risks, but I suppose it's this point that some of our risks are kind of, they're system risks. you know, the high level, the sort of principal risks. So many of them they go beyond us, don't they? They're shared with health boards and with other organisations that we work with. So there's just something about reflecting that, I think, somewhere in this, that you know, many of the things that we are involved in, the kind of risk nature of this is it's a whole system thing, and it picks up an issue then about, I suppose, how we have dialogue around those sorts of issues with other organisations where risks are shared risks. And you know, there's a variety of ways in which I suppose we do that through our engagement in all the various network meetings, like Helen with the CEOs, myself with chairs and so on, but also as we move forward with a programme of sort of board to board conversations, that whole area of sort of shared approaches to common risks, maybe something that we want to flag in those conversations. So just to leave that for a further conversation. I think Helen wants to come in, and you may want to comment back, Chris, on what I just said. I don't know, but Helen first.
It was in relation to that, actually, Bob, which is that you're quite right, and it's how the broader system risks in relation to digital are actually presented and understood, and that we see that picture. So there, and that happens at that digital leadership level, really, in terms of that, in terms of the digital governance that is being stood up, and there's a national digital delivery leadership group, and it's one of its key areas is to focus on risk, and that then can escalate risk up to the NHS Wales Exec Board, and that is what we've done previously and what we will continue to do. And as you say, we will feed that. I will work with the lead directors out in the health boards and the lead chief executive for digital to, you know, to make sure that is aired around the chief executive table as well, and then onwards up to the NHS Wales Exec Board.
Great, that's really helpful. Thank you, Helen. I think Marion wants to. Does Marion want to? Marion, do you want to come back in for the question, or have I? Or no, have I already taken your question?
No, that's fine. You've.
Sorry, Marion. I'm misreading the sequencing in the chat bar. Yeah, we've done your question. It wasn't another one. Okay, I think that's all we've got in terms of questions and comments in relation to item 5.3. So, Chris, thank you, and confirm that the board is approving the risk management and board assurance framework strategy and the associated milestone plan. But again, like a number of items on our agenda, this will come back for periodic discussion and periodic review as we move forward. That takes us on then to the next item, 5.4, which is actually more specifically looking at the current corporate risk register. And I'm going to invite Claire back again to take us through this through this item on the agenda. So Claire, over to you again.
Thank you, Bob. Before we get on to that, and I suppose moving on from what Chris is saying, so currently our risk lies under my responsibility, and from the 1st of July then Chris will obviously take the role and implement his new strategy around risk, which obviously we will fully support, and the current risk group will transition into that new arrangement. So until then, we have, as part of the Audit and Assurance Committee, we have reviewed the full corporate risk register. That was done on the 11th of May. And it was also reviewed in the Digital Governance and Safety Committee in their areas of responsibility subsequently to that on the 12th of May. But for note, the corporate position at the moment is in April, there were 19 risks on the register. 15 of those were are included in the public domain, and if you look at those risks within those, you can see that there are 8 of those which are considered significant. Again, the details of those are included in the appendix, and obviously I'm quite happy to take any questions on any of those risks should we have any. And that was all I was going to highlight in the report as of today, Bob, unless, and I'm happy to take some questions.
Thank you, Claire. No, I think the paper is self-explanatory, and as you say, we've got the actual risk register itself is there in the appendix. And you know, to reiterate what you've said, this is, as you say, this has also been through the Audit and Assurance Committee in terms of a detailed detailed look at this. It is an interesting one for me again, I think, in terms of, you know, reflected a couple of times today, the kind of uncertain environment that we operate in. I mean, things are always uncertain, but perhaps more so now than is normal. So I do think it's really important that we keep a very fresh look on risks and the risk register as we move forward, as things change and so on. But that's been very helpful. Thank you. At the moment, I'm not seeing any questions being flagged to me in relation to this. I will just pause for a moment to give an opportunity if anybody wants to come in with a specific question for Claire. No, I don't think so. In that case, Claire, I'm just going to thank you for that. We will note the corporate risk register today, and obviously come back to this as a sort of a standing item in relation to our forward agendas. That takes us on then to the next section on the agenda, which are brief updates from the committees which have been through their first cycle. So first of those is a report back from Marion Wynne-Jones, our committee chair for the Audit and Assurance Committee, the sort of highlight report. So Marion, over to you.
Diolch yn fawr, Cadeirydd. Thank you, Chair, and it's my pleasure to report to the board our first highlight report from our first Audit and Assurance Committee, which was held on the 11th of May. And just perhaps to say at the outset, I'm very grateful to our lead director, Claire Osmond-Little, and to our board secretary in particular for the extensive support that we received from them both. So key points to note then, we received the Bwrdd University NHS Trust closure report, and I'm pleased to note that I had a very helpful handover meeting with the chair of the Bwrdd Audit Committee, and there were no outstanding risks or particular issues that we've identified. As you'd expect, we approved the committee terms of reference and the cycle of business which were brought to the board as part of the consent agenda earlier today. We approved the internal audit annual plan for this financial year, and as you'd expect perhaps with a brand new organisation like this, much of that activity is end loaded. But I think it's important to note that we've built in an element of flexibility within that plan so that we can deal appropriately with any new risks or issues identified, and particularly, you know, sort of in the light of the COVID pandemic or any other issues for that matter. We also approved the Audit Wales initial plan for DHCW. And the financial control procedures, and just to remind you, we received and endorsed, as you've just heard in the earlier discussion, the risk management and board assurance framework strategy. If there are any questions, obviously happy to take them, or I'm sure Claire or Chris are happy to come in as well. So thank you. Diolch yn fawr.
Thank you, Marion. That's very that's very helpful. I don't know, Claire or Chris, if either of you want to add anything. Don't feel obliged to. No, I don't think so. In that case, I will move us on to, oh, sorry, Helen, did you want to come in? Before I move us on, I think Helen wants to come in.
I'm not quite sure how that's happened. No, I'm fine.
Okay, sorry, yeah. A queue popped up in my sidebar. Don't worry. In that case, I will move us on to the next report, which is from Sean Doyle, Committee Chair, in relation to our Digital Governance and Safety Committee highlight report. So Sean, over to you.
Diolch o galon, Bob, and I will, like Marion, very similar first meeting that we had on the 12th of May, expertly supported by Rhydian and jointly led, and also Chris and Sophie. It's worth noting on this one that this is a very new committee, and we presented this with very much a view that the agenda, because it's brand new, the agenda and it's probably terms of reference, which we did approve, will evolve as we operate over the next 12 months. We also noted the cycle of business and approved as well. We then also, the same as Marion talked about, endorsed the fact that the closure report from Bwrdd and that there were no major risks or anything to be handed over, and that was passed by the committee. We then moved on to a number of presentations which were presented by the teams around information governance, information services, notable events, and also the informatics assurance framework. And whilst we understood the framework, what we did talk about was what the ongoing reporting and content would be going forward for those committees. So that's something that we will be working on over the next few months, so that we make sure that we have the assurance required, but also provide the support to the teams in the event of in the spirit of transparency, to make sure that we're fully accountable. So thank you, team members, for those presentations. We also noted very quickly the actions regarding the European Union settlement status, no areas of concern to report, and there was a really good discussion similar to the Audit Committee about the risk management, and we had a very good discussion about the content of that, and a really good scrutinisation in the spirit, as I said before, of support and transparency. We then went on to a closed session around some of the sensitive areas around cyber security, and I want to reach out to Rowan as well. Thank you as Vice, and David Selway, who's also joining me on that committee. But as I said, I think it's going to evolve and really make sure that we have a really robust agenda going forward. So thank you, Bob. That's all I had to report, unless anybody had a question.
Thank you, Sian. That's very helpful. And if I can just add my thanks to both you and Marion for picking up the leadership on the two committees, and as I said in my opening remarks to the meeting today, to other independent members who've joined those committees as well. I'm not seeing any questions, Sian, so I'm going to move on to the next item. So we note both of those reports. The next one is with me as the chair of the Remuneration and Terms of Service Committee, which had its first meeting on the 30th of April. Couple of issues to bring back. The first is to note that the DHCW Vice Chair, Ruth Glazard, was formally appointed as the Vice Chair of the Remuneration and Terms of Services Committee, and the terms of reference were noted as per those adopted by the board at our first meeting on the 1st of April. So we're kind of fully up and running as a committee. We had a very specific issue that we discussed through the committee at its first meeting, which was an issue in relation to the payment of overtime payments for some DHCW staff at around band 8A and above, who in exceptional circumstances need to work out of hours. And I think this is one of those examples of where the Agenda for Change framework, which is really kind of designed for the wider NHS, doesn't always meet the requirements of more specialist organisations such as ourselves. So we do have a bit of an anomaly, I think, in this, in recognition of overtime payments, albeit on an exceptional basis, and the numbers are very small. This is a handful of people and a handful of occasions, but we are a 24/7 organisation at the end of the day, and needs must. So there was a request for the approval, or the ongoing approval, of a system that's been in place under the previous governance arrangements through NWIS and through Bwrdd and its trust, which the committee agreed to for the next 12 months, but also has requested that we look at this again as a more strategic issue to see what the options are for alternative ways of managing this issue in a more sustainable way. So it was just to note that was agreed to maintain those arrangements, but agreed with the condition that we actually do some further work around that over the next 12 months. The other issues that were flagged are they already feel a little bit historical, because the committee had the responsibility for the formal ratification of the 2 executive director appointments that we made, which was Rydian in terms of our executive medical director and Claire as our executive director of finance. So the committee ratified and also formally approved the remuneration and terms of service for those 2 posts. At the time, we had just recently made the interim appointment of Helen as our interim CEO, and that was for the committee to note the appointment, because the nuance of that was that the interim was made before the board came into existence and was therefore an appointment made by the health minister. So we were noting it. It wasn't technically our decision. The committee also had a discussion around the process that we were going to follow in terms of concluding the appointment process around the chief executive, which, as I've already indicated, has happened, and that was done. So I don't think there are any other particular issues from that, other than that, again, we noted earlier in the meeting today the importance of moving on to conclude the wider appointments of executives. We are, of course, quorate with the appointments that we've made, but it is important that we get the full leadership team in place and that is done. I think, as Ruth highlighted earlier, in the context of the wider organisational form that we have. So they were the issues that I just wanted to share back from the first meeting of the Remuneration and Terms of Services Committee. I don't know if there's any questions or comments on that before I move us on, which in fact is moving us to close. So any questions to me or anybody in relation to that? No, I'm not seeing anything. Okay, that concludes the formal business that we had on the agenda today. We're a little bit ahead of ourselves, which is always handy. I'm not aware of any other urgent business. No one has raised any other urgent business that they want to raise with me, but I will again just pause briefly. Helen, I think, wants to. No, sorry, it's not you, Helen. It's just the way the sidebar moves. I keep thinking you're asking a question. You're just moving up the order. So no, I don't think there are any other matters matters of urgent business that anybody is wanting to raise today. So that just leaves me to conclude then with the date of the next meeting. The next formal public meeting is Thursday, the 29th of July at 10 a.m. So the same start time as today. And as we said earlier, the aim is that we will be doing that on a different platform, but we will publish details of that well in advance of the meeting. So it just remains for me then to thank everybody for participating today, and to those members of the public and stakeholders who've joined us externally, and to wish you all well as I close the meeting. So thank you very much, everybody.